Teresa Heritage, and I am the chair of the meeting. I have an announcement to make, first of all, just to help members. Following the government announcing that the UK has now moved into the delayed phase of the response to the coronavirus pandemic, the Council will be holding this meeting electronically in accordance with the relevant regulations. Members of the public may also attend this meeting in electronic capacity, and there is a link on the Council's website for them to do so. Please could I ask all members to turn off their sound and their cameras and turn them on when they need to speak. There was a background noise there. So I'll say again, members of the Council are asked to keep their microphones and cameras switched off until called to speak, and to switch their microphones and cameras off once they have finished speaking. To indicate a wish to speak, members should request to do using the public chat function. I will ask members to vote for, against, or abstain for each item at the end of the debate on that item, and ask that members indicate their vote using the public chat function. Could I also ask members not to type comments into the chat function, but just use it for indicating to speak and vote? I will declare the result after each vote. Officers are in attendance, but will keep their cameras and microphones switched off unless called to speak. So I'll now ask members of the panel to introduce themselves this morning. As I've said, I'm County Councillor Teresa Heritage. I'm the chair of the panel today. I'm Deputy Leader of Hertfordshire County Council and also the Executive Member for Children, Young People and Families. Could we turn to Phil Bibby, please? Could you introduce yourself?
Hello,
Thanks.
I'm Phil Bibby. I'm Executive Member for Highways and Environment.
Thank you. Judy?
Morning, I'm Judy Billing. I'm leader of the Labour Group and spokes on education. And I just found that I've been locked out of the chat function, which is annoying because I would like to speak on page 28 of the COVID update.
Okay, I'll keep a note of that, Judy. Don't worry. Okay, thank you. Eric?
Good morning, I'm Eric Buckmaster and I'm Deputy Executive Member for Highways and Environment.
Thank you. Bob?
Good morning, I'm Bob Deering. I'm the Deputy Portfolio Holder for Finance, Resource and Performance.
Okay, thank you. Terry?
Good morning, I'm Terry Duris. I'm the Executive Member for Education, Libraries and Localism.
Thank you. Stephen?
I'm Stephen Giles Medhurst, leader of the Liberal Democrat Group and our spokesperson on highways.
Steve? Steve Jarvis?
Hello, I'm Steve Jarvis. I'm the Liberal Democrat County Council for Royston Western Rural and Liberal Democrat spokesperson for Growth, Infrastructure, Planning and the Economy.
Okay, thank you. Asif?
Good morning. I'm a County Councillor for North Watford, but also the Labour spokesman for Growth, Infrastructure, Planning and the Environment.
Thank you. Richard?
Good morning. My name is Richard Roberts. I'm the County Councillor responsible for adult social care in relationship with health. And as an aside, I chair the Health and Wellbeing Board. Thank you.
Thank you. Ralph? Need your microphone on, Ralph.
Sorry, I thought I had it on. Yeah, thank you, Teresa. My name's Ralph Sangster. I'm the Executive Member for Resources and Performance.
Great, thank you. Mark Watkin.
Good morning. I'm Mark Watkin. I'm County Councillor for Nascot Park Ward. I'm the opposition spokesperson, Lib Dem opposition spokesperson for Children's Services and Education, and delighted to be here.
Okay, lovely. Thanks, Mark. I'm glad you got here. Thank you. Okay, so those are the introductions. I'll now ask, do members have any interest to declare? Now, I know Terry Douris does.
Thank you, Teresa. Yes, I declare a non-pecuniary interest in relation to item 7, Adeyfield School. My grandson is a pupil at that school.
Thank you. Are there any other declarations of interest, please? No? Great, I haven't been notified any. Thank you very much indeed. So I'll now move on to the minutes of the last meeting. Just if I could say in relation to some action points at that last meeting, in paragraph 2.10, there was a request to provide education, reports on education in the weekly briefings to members. That has now been provided. In relation to 6.3, the recommendations to Cabinet were amended to include the reference to member and opposition involvement in the review of the documents being prepared for the ODU procurement. And those revised recommendations were accepted by Cabinet. And in 6.5, there's a typo. The timetable for the preparation of the ODU procurement, there's a strange word there, is being prepared, so that that's been completed. Okay. So may I ask members if we can accept those minutes, please? Could you indicate if you accept them in the chat button? Ralph, you have your camera on.
Teresa, can I just ask that since I can't use the chat button,
yeah,
it's not working for me at the moment, can I use the raise hand button? Will you be watching that at all?
Yes, it's in front. Hopefully I will be able to see both.
Okay.
Okay, I will manage that. Yes, sorry, Judy. Yes, okay. Right. Are you in agreement? Okay, I think we're there on that one. Thank you very much. So I'll now move on to item 2 of the agenda. And just to say, colleagues, this is going to be a long meeting, I feel, in my bones. And so if I'm correct, I will actually ask for a comfort break at noon for about 5 minutes, just to allow colleagues to walk around their office sitting room or living room or whatever. And hopefully we should finish, I hope, just before or just shortly after the lunch hour. So could I first ask Owen Mapley to present the county's response to the COVID-19, please?
Thank you, Chair. Really don't want to say very much at all. It's there's lots to get through in the meeting. It's another extensive report from officers detailing everything that the council has been up to in recent weeks. As always, I'd like to repeat my thanks for everything that is being done. Within the report, you'll see that there is more than in previous reports on things like recovery, as we've started to see the partial reopening of some services, including some year groups at schools, household waste sites. And there's also more information about the latest financial position and the latest funding we've received from central government. But I think the best thing to do is to say, just to invite you to debate the extensive report that has been prepared.
Okay, fine. Thank you, Owen. So, colleagues, what I'm going to do is I'm going to try and break this down because this is always a very beefy item. I'm going to break each section down, so we'll take questions, comments, etc., debate on each section as we go through. So I'm going to start first with section 6, if I may. If you could indicate if you wish to speak And Judy, if you put your hand up, I will keep an eye open for it. So is there anybody that wishes to speak on section 6? No. So that starts at page 19 of your agenda pack. No, I have silence. Thank you very much. I'll then move on to section 7, the economy. Richard Roberts, please.
My apologies, Teresa. I wanted to come in earlier and managed to get my my script all mixed up there. Can I just make a general comment, a few general comments? One is that I'm absolutely delighted that we are over the highest peaks that we saw for infection rates back in early to mid-April. That was slightly later, the peak of infection and mortality in our care homes. And we are now down to some very reduced levels in terms of infection rates and deaths in care homes. So, for example, residents of care homes, of whom we have just over 8,000, are now down to 1, possibly 2 or 3 a day, and hopefully repeating what our Director of Adult Care, Ian McBeath, said on Friday, that hopefully soon we'll regularly be seeing no COVID deaths at all in care homes in Hertfordshire. The other thing I'd like to do is just pass on my gratitude on behalf of the whole organisation for what's been happening with Shield and Sustain, where a large number of people, the government have highlighted some 40,000 people who are more vulnerable than others, and we have helped support all of those in some way or another, and are still distributing food parcels and medicines, both to them, but also to charities and to districts and other organisations who are helping them get through this pandemic. And that operation is run out of Mundles. And again, my thanks to all those that are making that happen, including volunteers now. And on the subject of volunteers, just to say that more than 10,000 came forward through Team Hearts, and approximately 50% have been found jobs right across the voluntary sector, again to help those most in need. So those are my sort of initial comments, if you like, and my thanks for what's been achieved, but also just hugely grateful, as the rest of the country is, that the rates of infection are right down, as is our mortality rates. Thank you, Teresa.
Thank you, Richard. Thank you, Richard. I've got Steve Jarvis, who wants to go back to section 6. Colleagues, can I ask you to keep in the order that I'm asking the questions on, please, because it's going to be a difficult meeting otherwise. So I'll go back to Steve Jarvis first for section 6, if I may.
Thank you. My apologies for being a bit late on that. I had a question relating to the impact of the test and trace operation on care homes, where there, I think, is identified a risk that large groups of staff might be asked to isolate by the test and trace operation, and that potentially has an impact on care homes' ability to staff their operations. What are we doing to help them overcome that potential problem before it occurs?
Okay, thank you. Can an officer take that? I don't know if Jim McManus is on the line, or Owen or Scott.
Morning.
Oh, Jim's there.
Yes,
Great.
I'm happy to take that unless anybody else would like to. The short answer is that we are working with Public Health England on guidance about care homes and self-isolation, because actually people in care homes will be in contact with people with COVID in some circumstances. So there is no need to do the kind of self-isolation that you would do if you were a casual contact in the community, simply because of the range of infection control mechanisms that the care home cell has put in place in care homes, and it's a special situation. So it's a bit like an NHS hospital with NHS staff, because you're in contact with people with COVID, and making sure that we cohort people so that people without COVID are not in contact with staff who care for people with COVID regularly, is where possible in some homes. I hope that's clear.
Steve, is that okay?
I think so, although there's also clearly a concern that care home staff will meet people outside the care home and will meet other staff. So I think, as I understood it, there was thought to be an issue that one might find significant numbers of staff required to self-isolate as a result of their other meetings.
Yes, so within, if I may answer that, Chair, within the care homes plan, we actually ask staff working in care homes to restrict their social contact as much as possible. And there are some care homes that are taking other measures, such as asking people to change their uniforms when they come in, so that the minimal possibility of bringing infection into the home is there. Also restricting the numbers of people who can go into care homes generally, other than essential staff. So there's a range of measures that should contribute, and I believe are contributing to reducing that, if that makes sense.
Okay, all right then, thank you. So Steve, I think if you've got any more questions on that, if you can take them up with Jim offline and he can give you some in-depth, walk you through the whole plan perhaps. So I've got Mark Watkin. Mark, is your question in relation to section 6?
Well, it's really more of a follow-up to Richard Roberts, so I'm not sure quite whether that was.
I'm actually taking questions at the moment on section 6.
I'll hold off and wait until
we've got
we get
ACS
to...
later.
Okay, fine,
great,
no problem.
thank you.
Thanks.
So now then, we are moving to section 7. If section 6 is finished. Asif, is your question on section 6?
It is, yes.
Okay, thank you.
Thank you. So can I welcome the setting up of the community reassurance cell, which is on 6.65 in the agenda pack. Can I just ask yourself or the officers or the lead on this subject about the impact on the BAME communities within Hertfordshire, because the impact of COVID has been, in terms of health, affected disproportionately BAME communities. And this cell, the representation within this cell with people from the BAME community to make sure that the community is recovering properly and any specific needs are met.
Okay, thank you. Which officer would like to take that one, please?
Chair, I've been asked to take that, if I may.
Okay.
And I think there's probably a couple of points to make. The first is that we actually have a webinar with BAME staff in the next week. There is a national review of BAME exposure to COVID-19. The findings were published yesterday. Some of that is about BAME staff, Black and minority ethnic people in the community, being more exposed to certain types of diseases, and we're currently working out what actions we need to take. But Sally Hopper from HR is convening that workshop next week, so we can address the actions. Happy to answer any further questions offline.
Okay, Asif, is there anything else?
No, thank you. I think I was one of the few BAME members as well, more than happy to take part in any workshop, so just to give my views.
Okay, lovely. Thank you very much. Okay, so I'm now going to move on to section 7. Okay, and Stephen Giles Medhurst.
Thanks, Teresa. It's 7.14. We did raise this at a briefing on Monday, and I thought we were going to have some clarification on this at the meeting.
So, Stephen, just in relation to the questions you raised at the meeting at the beginning of the week, there will be responses given to those questions by the end of the week, so they're not available for today.
I understand that, but this is a specific issue which requires clarification, I think, now, because the way it is worded, if this is correct, doesn't address the issue for businesses in Hertfordshire, because if this reply relates to the Hertfordshire Business Expansion Grant Scheme and European funding, it refers here to creation of one new job. It's not a question of new jobs we need, it's a question of protecting existing jobs that clearly are now at risk with the downturn in economy and businesses going belly up, and a number of obviously businesses foreclosing. So I wanted clarification as to whether this will support the small and SMEs that actually are facing bankruptcy.
Okay, thank you. Who's going to respond to that one, please?
Chair, sorry, Scott, over to you as Lepra.
Okay. Thank you, Chair. Yes, the issues regarding the business creations, the employment creation scheme, and he's been administered by the LEP, and the point that we've discussed is that where a number of businesses are having to think about new ways of now expanding their operations and changing their operations to then be able to increase the employment within their businesses to then offset some of the losses that may be being made in the wider Hertfordshire economy. So where maybe unfortunately due to COVID that those businesses are having to fold, etc. So as a result of that, with the business job creation scheme is then for those other businesses to be able to provide further employment to try to create the net and offset the net impact of job losses across the county. Thank you, Chair.
Okay. Is that sufficient for now, Stephen?
No, well, it answers that particular point in regards to that grant. What is not being answered is what we are doing to assist those businesses that potentially need financial support. If they had some financial support out of this funding, either from the LEP or central government, would stay in business. But if they don't get it, they will go under.
Yep.
In terms of SMEs, and you know, some of the high streets rely very much, certainly localized high streets rely very much on small businesses to stay there.
Yeah, yes. Apologies, Councillor. Yes, there are also a number of other schemes that are being either administered through our local authorities, the district councils, in receipt of business rate relief grants, business rate reliefs, grants for different sectors within the economy that businesses can apply for, and the county council, along with the districts and the LEP, have been active in promoting the availability of those grants. And from my latest statistics, over 85% of those grants and funding has been made available from the government have now been distributed to eligible businesses. And there are also other discretionary grant schemes that are now being established by local councils, of which we're just getting more further details on, but it will allow wider businesses that have not been eligible for grants up to this point to be able to bid for grants in those areas.
Okay, thank you, Scott.
Thanks.
Does anybody have any other questions on section 7? No, I can't see anything coming up. Right, we move on to section 8. So, Mark, you had a question on care settings? Okay, Judy.
Thank you. First of all, I'd like to congratulate not just our frontline officers, but our officers who sit in offices writing reports like this, because I think it's absolutely amazing the amount of information we get at every special cabinet panel. I think it's quite remarkable. However, moving to 8.6, which is children's services, obviously this report was put together long before any child entered any school other than the children who have been going all the time. And so I've been trying to track and follow what's been happening in schools locally and across the county as far as I could do since Monday. And I'm finding astonishing variations in take-up of school places, ranging from over 90% in a school down the road from me to under a third in some of the year 1 and reception classes in the same town. So I'm sure that Terry and others will have been tracking detailed information since Monday about what's happening. And I'd just like to hear some sort of report, either from an officer or from Terry, about their impression of what's happening across the county, because it's impossible for me to get that information as an individual.
Yeah,
and
Judy.
That's when I can have that information.
That's okay. Could I ask, I believe Simon Newland's on the call. Please, could I ask you to respond initially, Simon?
Yes, thank you, Chairman. I'm afraid at the moment we've only got an impressionistic view as to what's happened in schools county-wide. What we can say is that as far as we know, with only one exception, all our primary schools are open for at least some children. Now, I'm not absolutely certain of that, but at the moment we're only aware of one that isn't open. The main vehicle through which we would get information about exactly what's happening is through the DfE information gathering exercise, where each school has to put in a substantial amount of information onto a DfE website. Unfortunately for Hertfordshire, that isn't working very effectively, so we don't yet have a clear picture, and I'm sorry about that, Judy. We should have within the next day or two, and other authorities seem to be in a better place. What we can say is, as you said, is that there's a great deal of variability between schools in terms of the extent to which they're making provision available. Some are making more available than others, and that depends partly on local circumstances, but also in parental take-up. And that variation is not only between schools, but also within schools, one year group to another. So it's a rather odd picture. I mean, I could, we've got plans about how we're going to, over the next 3 to 6 weeks, work with schools to try to make the offer more consistent and, where possible, help schools to open more widely. But in terms of the information about now, that's where we are. As soon as we have something more tangible, we will, of course, bulletin members on that.
Could I come back, Teresa? Can't hear you.
Mine keeps going. Right, sorry. I was just going to ask Terry Duris to come in and see if he has anything to add, then you can come back, Judy. Is that all right? Terry Duris.
Thank you, Teresa. I don't have anything to add to the specifics that Simon has mentioned, but I think we should actually put a massive shout out to all the head teachers and school staff across the county for the work that they've done in preparing for the 1st of June. I visited one school and spoken to some other head teachers, and I'm hugely impressed with the commitment that they've shown and the way that they've actually gone about preparing the school to welcome back young people in reception years 1 and 6, and our appreciation should go to them. I can appreciate that there's a number of parents who have chosen not to send their children back into school, but I hope that at some stage that they may reconsider. But well done, the schools.
Okay, thanks, Terry. So Judy, did you want to come back, please?
Yes, I did. Thank you. And I don't understand why anybody should have thought that there was any implied criticism of the schools. They are doing a fantastic job. So are the parents, incidentally, many of whom are very frightened. But the fact is that even in my town, there are some year groups where only a third of children have gone back to school. And I'd also like to add, I don't know whether Simon, in his thinking that only one school hadn't opened, did that include the few academy primaries that we have? I'm thinking of an academy junior school in Hitchin, which isn't yet open. And I don't know whether that's the one he's referring to, or whether he's excluded the academies from his reply. It's important that we know. And I really would ask for information as soon as it's available, because it's really important data that we as county councillors need.
Yes, I understand there is a difficulty with collecting data, but Simon, can you come back on that, please?
Yes, certainly. I mean, in terms of schools which are open or not open, our information is clearly better with maintained schools and academies. But I think we've got pretty good coverage of academies. However, that junior school in Hitchin is not one that was on my radar. It's a different school in Ware, which I'm aware of being closed. In terms of the variation of the offer that different schools are making, this comes down to the way in which they've organised themselves for the purposes of infection control, and social distancing, if you like. So some have organised their groups of pupils into groups of 8, and some have organised them into groups of 10 or 15. And that affects the extent to which they have accommodation and staff available. There's also a much greater challenge for infant schools, where they're opening to, if you like, 3/4 of their relevant age cohorts, compared with primary schools where it's only 4 out of 8. So bigger challenge for infants, and therefore infants are less likely to be able to offer a full range. And of course, individual schools are also affected by the nature and the extent of their accommodation, and the extent to which they have key staff members who are not available as a result of vulnerability or shielding. So it is the case that there will be considerable variability across schools. What we are doing, though, is we're intending this week to contact directly and work with those schools which are not open, and only one was on my radar so far, but we will pick up first of all those which are not open, to talk to them about why they're not open and suggest to them that they're out of line with, if that's the case, with their peers. Next week we're intending to move on to those schools where they haven't necessarily provided for all of the year groups that the government has asked them to. So they may have, for example, year 1 missing, and to go into a process of establishing why that is and whether that's reasonable with reference to what their peers are doing. And then in subsequent weeks to start the debate with schools about the logic behind the bubbles, if you like, or the size of groups of pupils which they are working with. And I don't want to suggest that there's a single model and that some schools are right and some schools are wrong. What schools do is heavily influenced by their local circumstances, but at the same time it's quite right for us, where appropriate, to challenge them on what they're doing in view of the importance of getting these pupils back in school for those young people.
Okay, thanks, Simon. Can I also add that with the special schools, nearly all the special schools are open. Children there, the return by year group doesn't apply to special schools, and it's each school will be doing a risk assessment. So we're doing really well there. The schools are really doing well. Just a couple with a few blips, and that's in relation to problems with staffing. But so that I could say that special schools are really good. Judy?
Can I just thank Simon for the responses so far, make an absolute plea for as much information as I can have, and congratulate him for the lovely birds in his garden.
Thanks, Judy, thanks. Okay, so now I will move on to Mark Watkin, who has a question.
Well, first of all, yes, can I also thank Simon for the thoroughness of his response? And yes, I have also seen his garden before, and I'm sure he's living somewhere in Scandinavia, but that's another matter. Yes, I think he's answered a lot of my points. I think information is key here, and I'm really making a statement around the question, if I may. It's quite clear that there's confusion out in the community about what schools are doing, and a degree of sort of pressure being applied. Oh, well, they're doing this and the others are doing the other. So as Judy has said, and I absolutely support her on this, it's vital we have clear information about what schools are doing. And I absolutely take my hat off to heads who have to face the most extraordinary challenges. I mean, they don't know what their staffing levels are going to be, they don't know what their children take-up's going to be, and each building presents its own very specific problems. So absolutely, I support every school, but equally, I understand where Simon's coming from is quite right. The schools should be asked to explain why they're doing what they're doing. And I just make a little story. My 6-year-old grandson ran to school yesterday. He was so desperate to go back. It was lovely. My daughter took a video of him. And then that told me how much schools are missing from the children's lives. So anything we can do to bring children back into schools, the better. So thank you. That's all.
Okay, thank you. Okay, fine, thank you. I've got Stephen Giles Medhurst.
It always takes the time to press all 3 buttons to get the.
Yeah, I know, I have the same problem.
Everything back on again. Just on the scores one before I move on to the 8.2, the care settings. I understand what's being said. I think it's the issue that I have, and having spoken to some teachers, it is actually about the pupils who don't present themselves back to school, and they're further falling behind in their education if the school is able to reopen in a safe setting. And what we are doing to support the schools, or indeed what the schools are doing to get those pupils, because it's likely that the ones that have gone back probably have had some home tuition, have been supported by their parents, and are probably up to it. Whereas the ones, potentially, some of the ones that don't go back, perhaps haven't had that sort of support at home we would have liked them to see, and they're going to fall further behind education. I suppose in terms of the primary, it's slightly less of an issue. I understand, obviously, early years education is very important in development, but as schools further open and possibly more class sizes are increased, it becomes a bigger issue. So that was the first point. I don't even want to get that answered first before I move on to care settings, Teresa.
Yes, we'll deal with that one first. Terry, do you want to come in and respond to that at all?
Yes, very happy to. I think the one focus that we've adopted in Hertfordshire is to recognise that the individual school heads and the school leadership teams know their schools the best, and we've tried not to be draconian and tell them or instruct them what to do, but we do recognise within the government guidelines that schools should be welcoming pupils back in reception years 1 and 6. And so we've supported hugely all the schools, and hopefully they've taken up that support. It's the frequently asked questions, which is available to schools on the grid, is updated almost on a daily basis, and it contains loads and loads of information. I think there's an important point that has been made regarding communication, and I think, being very open about it, that there are probably some schools who have been extremely good at communicating with parents, and maybe there are some schools that have been perhaps a little less good. And again, we've been encouraging all of those schools to communicate with parents and let the parents know, because taking and, if you like, responding back to Judy about shall we say, a cross-Hitchin response, I'm aware that there are going to be different schools in different parts of Hitchin who are going to have different responses and different positions. So it's important that the individual schools liaise with their parents and their pupils and let them know what's going on. I think finally, I would say, in response to Judy's question about numbers, yes, we will, as soon as we have the numbers, we will make them available, but I don't want to speculate on what those numbers are, because I think that would be unhelpful. And we don't know what the numbers are, but when we have them, we will let you have them as well.
So can I ask Simon to come in and respond in relation to children that aren't attending? Can I just say that if children are in the vulnerable, either children in need or have child protection plans, the social workers are continuing to follow up with families, and they're working with the schools on sort of keeping track of the children. But I'm not quite sure what's happening. If you can say, Simon, what schools are doing if children aren't going in, to ensure that they know where they are, as it were.
Yeah, I think Terry's quite right to say that for the most vulnerable children with social workers, we are tracking quite closely what's happening to them, and their social workers are talking to parents or carers or foster carers about whether they should be in school or not. For other children, the DfE has made clear that there are no sanctions for parents or for children who don't attend, even if they're eligible to attend. And I think the key issue is one of confidence. And I hope that will evolve over time. So there's nothing particular that we're doing at the moment to press or enhance attendance of children in schools. But I have been talking to Jim about the possibility of looking at some messages to parents, schools and the wider community about the issue of just how safe children will be. Because I think, as people have said, there's considerable fear in the community about the risks of attending school, and I think that fear is generally somewhat overstated.
Okay, right. Thank you very much. So, can I just check? Are there any more questions around any of the children's services?
Could I just come back on one point on that, on the children's services, Teresa?
Okay.
And I think the issue is here not necessarily forcing children to go back to the school, because in some circumstances parents, for whatever reason, don't want the children to do, i.e. they themselves might be a single parent who are stuck at home because their job has ceased, and we've got to accept that's going to happen in some cases now, and they no longer have employment and they can't get childcare in the current climate. So it's a question of what support we're providing to the school, who are now having to operate a two-tier system, i.e. children in the school, but also educating those children who are at home and physically can't go to the school because actually, because of the parent's situation. And I want to be assured that the councils provide as much support as possible in that sort of area.
I understand that HFL and Public Health have done a toolkit for all the schools. But Simon, can you confirm that? That's sort of good practice, basically.
Yeah, I mean, there's been a very extensive document prepared by our educational psychology service about helping children get back to school and helping them with the emotional well-being dimensions of that. Which I think. What
about children that are staying at home, Simon, but not going in? Are they still being taught?
I think I think Stephen has put his finger on what is a tricky issue. And what is the case is that as schools start to reopen for year groups and teach those year groups in school, their ability to provide a parallel remote learning service is pretty limited. I think where children have to remain out of school, for example, where they are clinically extremely vulnerable, or they're shielding somebody who's extremely vulnerable, then schools will make a particular effort to make sure that those children receive good remote learning opportunities. But where children could come into school, and their parents elect for them not to do so, then I think it's unfortunately the case that they will start to suffer a deterioration in what's offered to them. And that's why it's really important for us with schools to continue the encouragement of parents to send their children in once they're eligible, so far as places are available. Of course, if they can't come in because the school isn't operating a full-time timetable for that year group, then the school will be providing remote learning.
Okay, so that's a challenge then, and it's basically up to parents and schools potentially to consider, but I'm sure that support is being given. Rather than go back on that one again, Stephen, because I think you hear that's a challenge, can I turn to Mark Watkin, who has a point, and then Asif?
Thank you, Terry. Yes, it's two things. First of all, and I only have had a limited contact with schools. What I've been instructed by actually is that in this period of lockdown, schools are very much focused that the children in need, children at risk. So I'm not suggesting that there aren't children who've slipped through the net, but I do get a sense that when they've had to prioritise, they very much prioritise on that area. And And there's a point in the paper referring to the future with children's services and the pent-up demand. I've seen some papers from children's services, and of course the problem is they just don't know now just exactly what the level of need or abuse has been like in the last month. So I'm really just commenting that we're now entering into this very strange world where trying to plan resources, trying to plan services for children's services is a lottery. And you will know this better than I by a mile, but it's we're in a very strange place at the moment. Artificially, our figures are low, but they don't reflect the reality of what's happening out there. That's all.
Yeah.
Thank you.
Yeah, quite agreed. Nationally, figures are low for children's services, referrals and contacts, but there is that pent-up demand, and the whole of the sector, shall I say, is gearing up for the summer months when potentially there will be more information and referrals. So yes, we're working up to that. Asif, please.
Thank you. My question's on the free school meals and free school meal children that are, or pupils that are entitled to it, and the security that they're actually facing. I've had a couple of casework examples of where it's children have been slipping through the net where food banks have to step in. So I'm just wondered how those students and those pupils who are entitled to free school meals are receiving the support that they need, even those that some might come back and still some at home.
Okay. Simon?
Yeah, I mean, inevitably, it's been the provision of free school meals has been a complex process, and the DfE introduced quite early on a voucher system, the option of a voucher system for parents and families, and that was a large nationwide IT project behind that, and it didn't work at all well. So there was a long period where there was disruption to the provision of vouchers to children and their families where they were eligible for free school meals. The DfE's preference, and I think our preference, is that schools continue to deliver tangible meals as opposed to vouchers. And many schools have, with Hearts Catering, made available packed lunches and so on for collection or for delivery to vulnerable pupils. And the intention is that where that's not available, then a voucher system is used. But it would be wrong to say that this has been trouble-free. It hasn't. There certainly were, particularly in the early days, some substantial glitches with that.
Okay.
Well, thank you.
Okay,
I think that's the story on the ground. Yeah, thank you.
Yeah. Okay. So what I would say is that if there are issues, please do refer families to their food banks, which I'm sure you're doing. The food is there. And I think I understand, for instance, in Stevenage, some schools have actually made sure they know where the pupils are that have problems, and they're actually knocking on their doors, and they have been over the last 8 weeks. So it's been different in different areas. Thank you. So are there any more questions on children's service matters? Nope. Okay. So I think we're moving on to it's 8.2. Is that adult care? Stephen?
It's
care settings.
Care settings. Would you like to come in now, Teresa?
Yes, please. Yes, thank you.
Yeah, and this obviously relates to the tabled amendment, or the addition rather, to the recommendation. I mean, this report obviously updates us as at the 15th of May. We've had more details since the 15th of May, which indicates now over 500 deaths in care settings that have gone round to members. And I'm a little bit concerned, a little bit of perhaps tempted complacency. Yet the deaths are going down in numbers, but no, one death is one death, and a family that lost a valuable family member. And I have considerable concerns here that the ONS were reporting.
Really, Stephen? Really?
Sorry,
Okay, carry on, Stephen. Carry on.
I'm concerned that the ONS in particular was reporting very early on that in Hertfordshire and West Essex seem to have a high number of excess deaths in care homes from all causes, and this has now since been confirmed by ONS data. And I think actually this points to some issues that need looking at when we have got over the initial crisis as to why we seem to have had excess deaths in care homes in Hertfordshire. In addition to the numbers that we've had in hospitals, which are well over 600, I believe, by now. And I think, you know, the track and trace that's been mentioned earlier and was mentioned very early on when we weren't going through this, in fact, isn't due in case of Hertfordshire in place until the end of June, as I understand it. And understandably, that will cause continuing concern within the care home setting as to what exactly is happening if that is not in place. Understandably, equally in 8.24, the report quite clearly identifies the additional money that's come from central government, which clearly is to be welcomed. One could say, and I know other commentators have, that perhaps it was a little bit late, but at least it has now arrived, and now some of the issues are being addressed. And understandably, within that 3.25 million is being set aside to support the control of the virus in the care home setting. So clearly there is still an issue there. You know, I'm not saying it should be an immediate inquiry, but I think at the very least we need to know at the end of this why there has been that sort of high number within the care home settings, and whether any policy decisions made by the trusts or in issues that the care home didn't have the equipment. And I'm concerned, certainly looking at my own local area, and I have raised this in the past with officers, that the percentage of deaths seems to be much higher in two districts, and I won't name them because it's semi-confidential, within the county, much higher than other districts in the county. And that may be the juxtaposition with London, the juxtaposition with particular hospitals. And, you know, it's interesting that, you know, although there's ups and downs on this, and the figures are gradually creeping down, they're not creeping down enough, as some experts say. And only indeed 2 days ago, there was another shutdown of a hospital only just over the border from Hertfordshire because of excess number of people being presented with COVID symptoms. So I am concerned about what has happened in the past. I'm pleased we're trying to get on top of it. Indeed, one would say probably we are now on top of it with care homes, but there is still an issue, still clearly an issue within that care home sector that we need to find out what went wrong, if anything did go wrong. Because actually the purpose of an inquiry is to find out actually we did everything we possibly could in these circumstances, and actually we did everything right. That could well be the outcome from that. Equally, it will point out, think actually if this sort of thing were to occur again, X and Y needs to be done at points A and B. So hence the reason for that addition.
Yeah, I think we've got the gist of it. Okay, so Richard, you've asked to come in before officers respond.
Teresa, if officers want to respond, that's fine. I'll tell you what. While I've got the mic, I'll just say a few things. The best response, I think, so far is what we sent back to Helen Waitley. Tom Hennessy did an excellent piece of work that was sent through the Chief Executive back to Helen Waitley as our response to infection control and our response to the epidemic, and particularly with care homes. I try not to repeat what I said at the top of this item. I don't think it's complacency to welcome that the number of infections and the amount of mortality in our care homes has dropped to very, very low levels indeed. And that is to be welcomed. That is not complacency. And I think that's slightly lowball from Stephen to even raise it in that manner. I am delighted with the work that has happened before as preparation for COVID. The way that we worked with our hospital colleagues across the CCGs to make sure that our discharges from hospitals were carried out in a manner which did not bring infection into care homes, but which allowed the hospitals to deal with the great number of patients that came through. I'm delighted that we've had support from Eastern North Hospital, the Hospital Trust, and West Hart CCG, particularly around super trainers, around infection control, and really good support from GP practices and the community trusts in helping with ourselves, social care workers and occupational therapists, supporting care homes and those that have had infection. I think that work goes on. I've also asked Chris Badger to carry out more than, I guess this would be best part of 2 weeks ago now, to really make sure that we understand and to bring into the public purview our understanding of what the Hertfordshire data looks like, because our proximity to London, and Stephen's quite right to raise this point, our proximity to London has meant that we had a number of referrals, we have a number of interactions between London and our care home sector, and there was a peak, and there are high numbers of care homes in both Hertsmere and Watford, and we've seen some of the higher rates there as well. Okay. So I think I'll leave it at that, Teresa. I'm going to see if officers have got more to add. Thank you.
Yeah. So could I ask either Jim or Ian, I'm not quite sure who was on the call, to respond to Stephen's points. I say for myself, I think we've done some good work in Hertfordshire, and you need to look at the whole national context. But is it Jim? Is you there?
No, it's Ian to start with.
Oh, okay, Ian, thank you.
I'll try not to repeat what Richard said, but a couple of remarks. Stephen, you wouldn't be surprised to know that we're already doing some studies about the death rates and the infection rates in Hertfordshire in care homes, and we're using some of the national models that are being developed. In fact, we're inputting to some of the national models, and it is true to say that early on in the pandemic, Hertfordshire was affected more quickly than other councils, certainly in the eastern region. And we saw that with Surrey and with Essex as well. Their care homes in the sort of southern and bordering London areas of their counties were affected more. And then over the days and weeks, we saw the virus creep northwards, or whatever the geography may be for Surrey, throughout to other care homes. There's a hotspot now in Cambridge and Cambridgeshire, so their peak has been a little bit later than ours. So they're the sort of spreads that we've been seeing, and government advice has changed throughout the last 3 months as well. So advice, particularly around PPE, changed quite dramatically from the start of the outbreak to the position that we're in today, using 25,000 pieces of PPE equipment a day in care homes in Hertfordshire. That advice changed, so we were sure that as soon as it did change, we got the messages out to care homes immediately through HCPA and through our commissioners to make sure that there was adequate supply, and care homes were aware of those new policies. We've got whole care home testing in place now, and Jim might want to say a few words about that, because he's leading the testing cell. But again, as soon as tests became available to care homes through our NHS partners and then through the government, we were making sure that hundreds of care home workers were being tested, either to isolate or to return to work and make sure that a safe and quality service was being provided. And it still remains my belief, and this will be proven in the long term, or disproved, I'm sure, that the majority of the virus was spread in care homes through people who were asymptomatic, through staff who didn't know they were carrying COVID-19 and so unwittingly went to work. And so before tests were available, then that's what was the initial spread. And that's why I believe that the virus spread from the south of the county, from London through to the north, through asymptomatic staffing. And so we're working with care providers, not only on making sure people have got PPE in case that's the case, but also in times like when they're in the staff room and they take their PPE off. Well, they may be asymptomatic, so don't take your PPE off. We're getting messages out now to really quell the cross-contamination and the spread. Final thing I wanted to say on the Infection Control Fund, which is mentioned in the papers, it is good news. £600 million nationally has come from the government specifically to look at, is there anything extra we can do to contain staff groups and therefore contain the spread of the virus. So the government are very interested in care homes who are able to have staff move in, or have staff accommodated somewhere locally to try and prevent the spread of the disease by those staff mixing with other family members or other people as lockdown eases. And so the money's been provided to care providers so that money is not the reason why staff don't spread that, contaminate others unknowingly. The Care Home Resilience Plan, as Richard says, got a lot of detail in there, and I'm happy to discuss any of that with any member at their request.
Thank you, Ian. Jim?
Thank you, Chair. Firstly, I'd agree with everything Ian's just said. And to deal with a couple of specific points on testing, we have a testing cell in Hertfordshire that has prioritised care homes. We now have whole care home testing arriving at a time for both symptomatic and asymptomatic staff and residents. We have pathways in place and we've started that. I think Ian's right that the bulk of COVID-19 transmission, not just in care homes but nationally, has been through asymptomatic people, at least 60% of that, and including some super spreaders. And the plan that we've put in place in Hertfordshire in terms of PPE, the testing, the infection control and enhanced cleaning in care homes, and the stuff Ian's just mentioned about cohorting staff, is actually designed explicitly to reduce and disrupt that infection. And you can see that the infection started in London and spread northwards. So there are bits of the east of England that are behind us because they started their peak later than we did. So in my view, we've acted on the evidence, we've stood up testing. We went beyond the guidance on PPE, as Ian said, to the point where we're using 25,000 pieces of PPE a day as soon as we could as an extra precaution to reduce infection, when the national guidance was saying don't use PPE as much as we are here.
Okay. So can I now go to Judy and then Ralph?
Yes, I wanted to just make a very simple political point in response to Stephen's remarks about complacency. And I think it's important, as leader of the Labour Group, that I make it absolutely clear that I have been utterly disgusted by some of the response to this pandemic from the government. Less at the beginning, but very much so over the last few weeks. Heard advice that applies to me changed within 24 hours because it seemed expedient for it to do so. But I would not for 1 second apply the term even could be seen as complacent to any of our officers or indeed our politicians in Hertfordshire in the work that they've been doing. So it's not like me to crawl all over Richard Roberts and say what a great job he's doing. But I don't think a charge of complacency or even the appearance of complacency is reasonable, although I thought Terry was slightly about the opening of schools.
Thank you, Judy. Thanks for your comment. Ralph.
Yes, thanks, Chair. I just wanted to address a question to Jim, if I may, and it's in relation to making sure that we don't draw too narrow a review position on any individual item of concern, because I'm sure that that there is going to be at some time in the future a fairly broad assessment of how we responded to the COVID situation, and ensure that the interreaction between various service areas is taken into consideration, as such, it would seem inappropriate to dive in and do a report or a review on one individual item when that broader review is probably coming along down the pipeline.
Okay, thank you. I mean, I think I heard from Ian that we're already holding in effect an inquiry or doing a report on care homes. Could you just confirm that, Ian? Sorry, I was listening, but
it's not a report as such, Terry. We're looking at the data and comparing ourselves nationally and with national studies to make sure that we're not an outlier. And the early data shows that we're not. We're middle of the pack. I mean, I prefer to have 0 deaths, of course I would, but we're not an outlier by any means.
Okay. Well, we had at this point, colleagues, I am going to bring in the proposed amendment to the recommendation that Stephen Giles Medhurst has tabled. Now, you should have all received these amendments by email. If you're technically able, if you could look at them, please. But I will just read what Stephen has put forward, and I'd like to have a debate on this, a very short debate, if I may, on this one. So he's asking to add to the recommendation on 2 that the panel notes the contents of this report, including planned approach to dealing with the financial implications. And he has added, furthermore, sadly, due to the reported higher than normal levels of deaths in Hertfordshire care setting, request the Cabinet to undertake a full independent, full inquiry into the management of COVID-19 in the care sector in Hertfordshire once the crisis is under control. Given that we're talking about the care sector here, I thought we'd bring it this particular debate in. We won't vote on it now, but can we actually have a debate on this amendment, please? Are there any comments from any members? Richard?
Thanks, Teresa. I kind of haven't we just answered this? Hasn't Ian just answered this? There is detailed ongoing study of the data surrounding COVID. You would expect us to be looking at that in great detail, and we should bring that into the public domain in the same way that I was absolutely insistent that we brought all the data around what was happening in care homes in the public domain and make sure that members had that information and MPs at their fingertips. I'm not sure why Stephen's amendment adds to that sense of urgency and sense of need to make sure that we're all over this like a rash. So I'm not sure what the debate is here. We will, and I would think we should do this relatively quickly, if not the next, probably not for the next special cabinet, but perhaps the one after that. Really bring the analysis through for members to see. But I don't see why that has to be an amendment from Stephen. I mean, that's a recommendation. That's the work ongoing. That's what we are doing right now. Thank you.
That's what we are doing. Absolutely. Okay, fine. Thank you. Eric.
Thank you, Chairman. I just wanted to say briefly, I agree with what Ralph said, because the whole COVID crisis has had such an impact. None of us have ever experienced anything like this before. And I think the most important thing is to take the learning points. I think there's been some amazing work by the community, by the officers, to address these things, but there will be some very positive things for us to take forward for the future so that we know how to react and respond if ever we're faced with anything like this again. So I think it's a bigger review rather than on a specific item. Thank you, Chairman.
Thank you. I apologise, Ralph. I should have asked Jim McManus for a response to your comments regarding the general review of the whole pandemic. Could you comment, please?
Thank you, Chair. I mean, Ralph is correct in that there will be a national review. That's for national government. There always is after a pandemic. And it will be interconnected because we have a series of epidemics that are clearly interconnected in the way the epidemic has spread. We know that now. I guess the point I would make that those local studies, and I'd call them studies that we're doing, are kind of epidemiological surveillance studies and fairly technical pieces of work to look at dynamics of infection and look at where we can intervene. That's a very different thing from what Ralph has suggested as a national review. But Ralph is right, any national review that comes will be very much an interconnected and multi-strand piece of work.
Okay, thank you. Judy, did you want to come back? Sorry.
I've only just found the amendment, but having read it, what's in my mind to say to Stephen, I think, is that there are so many aspects of what we're all living through now that we're going to need to look at fully through inquiries, through scrutiny reviews. I'm thinking of the way that children have not been properly fed who are on free school meals. I'm thinking of deaths in care homes. I'm thinking of education. I'm thinking of domestic abuse, which we know is not being properly reported at this time. There are so many things we're going to need to look at. And the thing that makes me most worried about this amendment is the last few words, once the crisis is under control. I don't think I know what I'm going to know for an incredibly long time what I consider to be this crisis being under control. And that therefore is just too vague for me. So I will abstain, not because I don't think we need all the information we can possibly look at, but because I'm not sure picking out this particular issue in this way is going to help us look at the whole picture. That's all. It's not a hostile act, it's just an abstention.
Okay, that's fine. When we come to that, Judy, that'd be lovely. Phil Bibby.
Thank you. I just wanted to point out that it's probably a common opposition ploy to ask for public inquiry if anything goes wrong or seems to go wrong. I think it's quite correct that there will be a national inquiry and review, and we will obviously be looking at how we can learn from our experience. So I see no reason for us to commission an independent inquiry ourselves. This will happen nationally and everyone will learn from their experience.
Okay, thanks. Stephen.
Thank you. If I can come back on a few points, more than a few points. Effectively, what Ian and Jim have said, that we're already starting the work for an inquiry in terms of what has happened in the care setting in Hertfordshire. And I think that's in itself is self-evident in terms of why this should be supported. Now, if Judy wants us to drop once the crisis is under control from this in order for her to support it, I'm content to do so. But the point is, we have a particular issue in Hertfordshire. Yeah, I have read reports of issues in other authorities. It's for them to decide how they to go down the route of looking at what has been the issues, either within their care home settings or elsewhere. Once you broaden out, and indeed this report doesn't broaden out in terms of the COVID report before us about domestic violence and other issues. Now, once you broaden out to that, I believe it comes a bit more in the mix as to what has been the issues. Yeah, I could ask for an independent inquiry in terms of what we're doing on active travel. I'm not into that frame of mind to do so. We have identified within Hertfordshire, and indeed Ian and Jim have identified some of the potential issues around that. And the fact that we know they've actually gone over and above what the government said in terms of PPE provision. Now that needs to come out in terms of what we have done. I see nothing wrong with actually having that investigation and having that completed. Now, if there was a recommendation from the administration that there will be a detailed report covering all of this, then that might be content. But we appear to be a little bit backtracking on that. And I was very careful early on not to mention 2 digits. I know Richard now has. That now is in the public domain. So I'll make the point, a 12% death of care homes in Watford compared to 2% in North Hart. Now, there may be reasons for that, and I need to know those reasons, I think, and my residents want to know those reasons. Now, it may be, as Jim has said, located in terms of its juxtaposition to London and to Harrow and Barnet and so on. It may be because actually Watford General cleared out all their wards very, very early on, and asymptomatic patients were sent into care homes. The answer is I personally do not know, and I'm not the expert to know, which is why you need actually an inquiry to find out what the reasons behind that were, and why, unfortunately, we've had in excess, on basis of figures that we've been provided with, 500 deaths in the care setting. So I think that's an important issue for Hertfordshire residents to understand what has happened. Now, if Judy and others are saying actually it should be done now, I have no problems with that. I was trying to be helpful and not overburdening officers and indeed the administration, and saying has to be done this very minute, by saying once they felt it was under control. Some people believe it is, and I would echo Judy's points. I've been dismayed, I have to say, with some of the comments from, or differing comments daily from different ministers as to what should or should not be happening. And that I think is not helpful, but I'm not into making an attack on the government on that at this at a Hertfordshire forum. I don't know what went wrong. I don't think any of us really know what went wrong, or indeed, for that matter, the measures that Hertfordshire undertook may have actually suppressed the number of deaths that could have happened in the care home setting. And indeed, from what Ian and Jim have said, that may potentially be the case. That, in my mind, would actually be a good result in terms of doing an independent inquiry.
Okay, thank you, Stephen. Can I just have a quick response there myself? I think what you're asking for is actually something that the administration is already doing. If we have concerns about anything, or there's a big piece of work happening, we do inquire and research and look into what we should be doing, as Richard has already said. I think you can be assured that towards the end of the period, who knows when the end of the period is, there will be a report. A full report will come back, no doubt, to one of the particular panels, or even cabinet, when we're looking at recovery. But I think what you're asking for, a full independent inquiry, is something that I probably couldn't support, because actually you're telling us to do our jobs, which we are doing. So I would robustly push back on that one. So I have Steve Jarvis, then Richard Roberts, and then we're going to move to the next subject in this section, if we may, please. Steve Jarvis.
Thanks. I mean, Phil Biddy said that it was the place of opposition to ask for inquiries, and I'm bound to observe that seems to be the role of administrations to say we should have a bigger inquiry later on. But I think actually here we've identified that there is a specific area where there is concern about the impact on care homes in Hertfordshire. I mean, there is clearly a national concern about the way in which the whole pandemic has been dealt with nationally, and why the UK appears to have done so much worse than almost anywhere else. But that's not the issue that we're talking about. We're talking about a specific issue, and we've actually heard both from officers and I think from Richard that quite a lot of this work is already being done. So if it's being done, why is the administration not prepared either to agree that they're prepared for someone independent to look at what they've done and see whether and confirm it's satisfactory, or even to commit that they'll publish it? It's just that they might publish it sometime later. If everyone thinks, as they probably have, that a great job's been done, why is there a reluctance to make that publicly known?
Richard.
This debate has suddenly taken a rather strange twist. Let's just be clear what is happening in the public domain. The Health and Wellbeing Board is meeting on the 23rd of June, and most of that meeting will be devoted to how our interagency work has tackled the pandemic. I've already said that the work is underway to understand what's going on. I don't want to wait for any longer than we need to understand what's going on. Don't need the epidemic to completely end, which it may not do, as Judy said, until possibly well into next year, or until we get appropriate medication. The health scrutiny has also got a broad agenda, which is already set out, that it will bring an autumn programme of really detailed scrutiny of what's going on. And I don't know who would independently come into Hertfordshire to audit our actions. The leadership team contains nationally significant officers, and I have faith in them to be able to understand and pull apart and to bring into the public domain through the normal processes that we have, which would be through the panel process and cabinet, to let everyone know there is nothing to hide here, and there never will be anything to hide. That's what we will do in Hertfordshire. Thank you.
Thank you, Richard. So, Judy, is this part of the debate, or are you asking a question? Judy?
It was complete accident.
Okay, fine. Thank you very much. Okay, colleagues, thank you very much. Thank you for your comments. As I said, we'll leave the voting until the end, but I thought it was important, whilst we were talking around adult care, that we covered that particular amendment. So that was really useful. So can we move on into the rest of the report? Does anybody have anything else they want to talk about in relation to section 8 of the Hertfordshire's response to COVID, please? Can I just say I am going to guillotine this particular conversation as soon as possible, if I can. So, Stephen, around 8.7, you tell me. Environment and infrastructure.
Yep, thank you, Teresa. Yeah, it's over the active travel and the further announcement from the government. Apparently, I need to be much closer to my iPad for everyone to properly hear me. I understand the county's been allocated 1.698 million for immediate works, which I assume is the 16 sites, one of which is still to be done, and which I've yet to see plans, even though I was told yesterday it's going to be implemented this week. But no local members have seen any plans for it, and 6.791 million for more permanent measures. And that first lot's supposed to be in the first 8 weeks. Obviously, that was after this report was drafted. And I've now seen sight, although apparently I am one or two other members of the only ones who've seen sight of all the other schemes that are likely to be on list B. When are those schemes and details going to be discussed with members?
Okay. So who have we got on the line? Mark Kemp?
Yes, me Chair.
Yeah,
yes.
Okay, thanks, Mark.
Thank you. So in terms of the announcements around active travel that came out last week, there are a number of quite challenging requirements around it that we're currently trying to clarify with DfT so that we understand what we're able to ask for and what we're not. What was quite clear, though, was that whilst the initial guidance suggested that any work on the high streets that was done prior to the 1st of June wasn't included, in reality, that's not the case. And as long as we can evidence that we weren't planning on doing these works when we originally developed the programme of works for the council back in February, then we are all right to claim for that. So we are currently pulling together the information to put that against that 1.25 million. In terms of the further money, as I say, we're still seeking further clarification from governance as what we can do. In relation to the high streets themselves, the work on St Albans Road, Watford, which you're referring to, we're still, obviously, we've been working with borough council officers because they're looking to do some work in that area. And as we've done with all the other plans, we're looking to get those plans to local members as soon as they're drafted and available. And I recognise that that's not, and we'd much rather have had more time. But in terms of the resources that we've got and the discussions with our public health colleagues around the need to enable people to socially distance high streets once the shops open on the 15th of June, then we've done the best we can to make sure we could do that, and then work with local members and shopkeepers on those fronts once the initial scheme is in place to tweak it and make sure it's in the right place. And for the majority of the sites now, we're getting to the place where we're comfortable, and we seem to be getting more positive noises from members and shopkeepers around what's in place. I think the further money also needs to consider what the future looks like, because we don't really want to be looking at orange barriers in our high streets through till next spring, if we can possibly avoid it. So some of the discussion that we're having with DfT is what we can do to make those areas more attractive, so that we can support the recovery of the high streets in a more proactive way.
Okay, thank you. Phil, you want to come in?
Yes, I'll come in as soon as I put the mic on. Thank you, Chair. Mark's sort of stolen a lot of what I was going to say, but I would like to add that discussions around this further money that's been announced are quite interesting, because it's really geared to more longer term cycling provision, i.e. taking highway space and making it friendly for cyclists. We're hoping to have some of that money fund the work we've done on these 16 sites, but that is subject to negotiation and discussion with DfT, which is quite a complex issue. On the second tranche, we're really learning from experience, and we have got more time to consult with members, which is what we'd really like to do in the real world. Unfortunately, there could be an issue regarding equipment, because just to let you know that from the initial equipment we ordered very early, because I was very conscious that we needed to get in front of the queue, we did get into the front of the queue, but we only received 30% of our order. And there's now about a 6-week delay in actually getting kit. So it is really subject to the barriers, etc., being available, need in consultation with local members and officers. So watch this space on our second tranche, but we'll try and get something in as soon as we can.
Okay, thank you. Stephen, did you want to come back on that point?
Yes, I did. I did want to come back. I had to say the exclusion of members on discussion of these early schemes has led to chaotic situations which I know are now being addressed, but they could have mainly been avoided if members had been given us some advance notice. And that's our group's beef, and I think it's a beef of a number of members across the spectrum. And I want to ensure that's avoided. Now, it's good news if we're going to have money for additional cycling routes. My group have been banging on about this for years, about encouraging cycling and keeping the current routes clear, let alone new ones. But there needs to be engagement with members over how that's done and what is spent. That's the point.
Okay, thanks. So I've got Judy Billing, Steve Jarvis, and Phil wants to come back. So Judy.
Yes, it was deliberate this time. I've not mostly understood about these 16 sites is the difference in local approaches that's gone on. So I hear Stephen's fury and anger about what's happened in Watford, but I have to say that in North Hertfordshire, weirdly, for once in a blue moon, the district council, the county council, the local bids have been involved in discussion and planning from the beginning. Now, this has meant that in Hitchin, we've decided we don't like those barriers at all, and have come up with a better scheme that's going to, so if there are only 30% of them delivered, you can have some of those back because we don't want them. But my question is, I go to a weekly or fortnightly meeting with our lovely Police and Crime Commissioner with colleagues from all over the districts to discuss what's going on. And I have found members of district councils like Stephen absolutely furious that they've not been involved. So how did that happen? Where was the methodology that allowed some areas to do it in a very civilized way and others to exclude members altogether? I don't understand that at all.
Mark?
So, Chair, we haven't taken a different approach in any of the actual 14 locations now that we are implementing measures. As soon as we had plans available, we provided them to the local member. We've then implemented what was on the plans, and we've then tweaked in discussion with the local member and the shopkeepers and other concerned stakeholders the designs that are in place. So I think it's just well, I can't comment because we've not really done anything different. The one thing I would say, if I could add to what Phil was saying about the second tranche, our hope is that the public will observe social distancing appropriately in those locations, and therefore we won't need to put anything in place. But it really relies on the public to actually observe that social distancing. If our public health or police colleagues get concerned about it, then we will have to end up putting in whatever schemes we manage to develop over the next couple of weeks in consultation with local members.
Okay, thank you. Steve Jarvis.
Thank you. I mean, clearly there have been some issues in some of the initial schemes. I'm glad to hear that some of them have been sorted out. There is still some need to be. I'm more interested in talking about what's going to happen, not with the second tranche, but with the longer term schemes. But this clearly provides an opportunity to do some of the LTP4 related things the council has been talking about for a long time. So I'm interested to understand what the process is by which those schemes are going to be identified and how we're going to progress that.
Okay.
Since I understand we have a fairly limited time to identify what we're going to do with the money under the DFT requirements.
Okay, thanks. Mark?
Yes, so we're currently looking through the works that we already were aware of that do these kind of interventionist type changes, which is what government are saying that they're looking for, putting together a list of things that had already been through the process in reality with members. We are also in discussion with DfT because, as you say, the time frame is pretty ridiculous in terms of our ability to respond in a meaningful way. And I'm aware from discussions I was having with DfT this morning that they've had similar responses from a number of authorities. So at the moment, we've been focusing on getting the high streets right, which I think is what we need to do, and the way we need to prioritise our resource to do that. And then we're then looking at the other information that we can submit. We'll need to obviously share it with group members, portfolio holders and shadow portfolio holders as we move forward and try and get something through in line with whatever time frame government eventually agrees to.
Okay. Phil.
Yeah, thank you. I would just briefly add to what Mark just said on the this new money that's been announced. Believe it or not, we have to bid for the first tranche by the end of this week. So I think you understand that consultation is probably going out of the window again. That's the situation we're in. It's not very acceptable from our point of view, but we have to put in valid bids by the end of the week to save any chance of getting money. If we don't, then we would be penalised in the next tranche of money when it's announced. I keep on trying to get this over, and I will try again. Put yourselves in reasonable position of the officers. We were told or tasked by the DfT 2 weeks before the lockdown was due to come out to put these measures in place pretty damn quick. And we knew, and they then announced that all shops are going to be opened mid-June. So we're grateful that we did get the kit on the ground in time, because it would be absolute mayhem mid-June if we hadn't done this work. We would have loved to consult and take a long time to actually decide exactly what to do and get it right first time. We didn't have that luxury, unfortunately. I hear that other councils have gone the consultation route and perhaps indecisive, and they will probably not be able to do anything with their high streets by mid-June when all the shops are open. So who can tell what's going to happen there? Also, as I say, there's a 6-week wait for delay for kit now, so then even if they have plans, they're not going to be able to put them on the ground. So I do stand by what the officers did. There was no time for consultation, as bad as that made us feel, but we had to do something very quickly. This was a health emergency, something which we had to respond to appropriately.
Thank you. So can I just ask you, Phil, in the past when there's been government funding, we've needed, in quotes, oven-ready schemes because money used to come from nowhere. Is that the situation we're in at the moment? We're using our oven-ready schemes, as it were, to make a bid?
It's interesting because we've got some oven-ready schemes from our top priority list, but these schemes don't come within that. This is really something completely new, where we are all of a sudden pinching highway space and putting in cycleways, etc., which is fairly new. And it is a challenge for officers to come up with some schemes that we can actually put forward. But that's exactly what they're going to do by the end of the week.
OK, thank you. Bob Deering.
Thank you very much, Terry. At the risk of being slightly parochial, I'm my division includes the centre of Hertford, where some of these town centre measures have been implemented. And I just want to say that whilst it would be fair to say that on day one, day one was a difficult day in the town, from there on in, I think the position has just consistently improved. And I think the interaction between the county council and the district council has been very good. And I think the people of Hertford have come to realise that there is no background historical experience to draw on here, and that actually everybody is doing their best in very difficult circumstances. And I would say that today the view in Hertford is that, yes, they understand why the measures are being taken, and they accept that it's a difficult thing to do, and it's certainly a difficult thing to do with absolute perfection. And I'd like to acknowledge the work done by officers as well. Thank you very much.
OK, thank you. Stephen, you want to come back?
Only because partly Phil's introduced a new item there, which I don't think was clear on. So it's 1.698 to be spent in the first 8 weeks, and then 6.789 million to be spent on permanent measures for cycling. And if I understood Phil right, he's saying the bid for that 6.791 needs to be in by the end of this week. I just wanted clarification from that or from Mark Kemp. And in relation to that, I mean, I put a proposal in for us very early on for a completion of the cycle route, which I've not heard back from officers, I have to say, and that was 4 weeks ago, which could form part of that 6.7. That's very parochial. And I just wanted to make it clear back to Judy, it's not the question of things going wrong in Watford. I think the high street scheme in Watford actually has been reasonably successful, I have to say. There are some tweaking still to be done. I'm waiting for traffic signals to get back to me. But had I not pushed my way into the early meetings, decisions would have been made that would have made it actually very disastrous. And I think that's where it's the local engagement. And it can only be for 24 hours. Yet schemes due in on Friday. Tell us your views now. Get feedback within a couple of hours, and things can be amended. And that's the grit. And I understand there was problems in Potter's Bar, there was problems in Borehamwood, and there were certainly big problems initially in St Albans, all of which could have been resolved with a quick phone call with the local member talking through the scheme. And that's where and I do know a district leader got hold of a list of schemes for the next tranche with the email, and officers were specifically told not to tell the local council leader what was going on. And Mark is well aware of that situation. I won't go tell about who it is because they're not present on this call, but there have been issues. I don't want to see that repeated again. I understand if you've got government deadlines, it's very, very difficult. I do understand that. But a quick phone call, and quite frankly, with the current technology, a quick Zoom or team meeting resolves lots of the problems.
Okay, well, I think we've heard your point, Stephen. Phil, you want to answer the funding question? Your microphone's not on, Phil.
Sorry, thank you. Yes, I just wanted to answer the funding question to clarify for the minutes. The bidding by the end of the week is related to the smaller bit of funding, about 1.6 million pounds. The further tranche can be bid for later. The deadline is for the small tranche of funding.
Okay, fine. Thank you very much for that. Judy, have you got your hand up again?
Yes, I'm sorry. I just wanted to make Stephen Giles Mater, so I agree with him. My question to the officers was why wasn't everybody consulted, not why was only Hitchin consulted? That was all.
Yeah, okay. I think we've been around that one, round circles in that one. Okay, so I'm now going to move on out of environment. Where are we? Is there anything else on community protection, public health, or resources?
Sorry, I have put.
Sorry,
that's
yes.
quite right. I have put a request. Yes, I just wanted to know. There's been a lot of interest expressed to me from parents about school streets, and in view of the fact that we've been discussing about the whole question of access and safety, and I just wonder where the views of the county officers lie now in terms of looking at the potential for school streets, which in briefly mean that the streets are closed between the hours of whatever 9 till 8:30 till 9:30 or whatever they might be, 3 to 4:30, to enable safe access to schools. I think it's a very interesting concept, but I've not heard anything from the authority on what their views are. So is that a good chance just to raise it here, please?
Okay, I personally haven't heard of them, but anyway, Mark Kemp.
Thank you, Chair. I think in one of the recent COVID briefings for members, we explained that we are starting to look at what the art of the possible is around social distancing and linking that to school streets activity. Given the numbers of years that are coming back in before the summer at the moment, so the years 10 and 12 for senior schools. And obviously the early years in junior schools, what we're looking at is reviewing the opportunities over the summer, so that if there is an opportunity to put something in place, we can put it in place for September when the schools will hopefully open fully.
Can I come back, Terry, if I may?
Yes, certainly. Yes.
Well, I mean, it's just, Mark, I'm not expecting a kind of instant solution. In fact, heaven forbid, because I can see my own division, there could be some very contentious decisions to be taken if we'd rather than one size fits all. I think I just really want some clarity about direction of travel, maybe guidance as to how these can be considered and assessed, a strategy, in other words. And yeah, if there's some obvious easy wins, of course we should go for them. But I think it's more about making sure that we build this into our future strategies.
Yeah, I think I'm hearing that it's there and the officers are working on it, so I'm sure there will be a process. Thank you, Mark. Terry Douras.
Thank you. Thank you. Just to pick up, I wanted to talk about something else and libraries, but I think I do need to just make the point that there's an adage, the best decisions are made with the benefit of hindsight. Well, in fact, where we are at the present time, looking at the discussion about town centres, we haven't had the opportunity of hindsight. And I think there's a word or two words that have been used frequently recently, and they are at pace. And I think, and the risk of Judy coming back and saying that I'm being complacent, which I am not, I think officers have actually done a remarkably good job in delivering something at pace, which would otherwise have taken months, if not years, to achieve. So there is a benefit, and we can actually draw a benefit from this going forward. So let's just take a positive spin on it instead of actually picking up all the things that we might have done marginally better and pretending or suggesting that it's a negative thing. On the question of positivity, I want to share with you some numbers briefly regarding library usage in April 2020 compared with April 2019. And of course, at that time in 2020, all the libraries would have been closed. So we were relying upon our e-library service and our online services. And the number of people actively borrowing from our e-services has more than doubled by 110%. Issues across the e-services have also more than doubled, 119%. Visits to the e-magazines have gone up by 87%. Visits to digital newspaper services, Press Reader, have more than doubled, 137% increase. And visits to Universal Class, the online learning platform, have increased, would you believe it, by 175%. And finally, because I'm not going to speak for a long time, visits to BorrowBox, e-books and downloadable audiobooks have increased by 67%. So that's in conjunction with a whole range of activities that have taken place in our library service across the county and in different libraries that have been doing different things. In particular, I think about the project with Lego at Welwyn Garden City and other places, and the Reading Together concept. So I just wanted to say, well done, the libraries. Sorry, perhaps I'm being complacent, but well done, libraries. The team have stepped up to deliver a service in these challenging times for people who are our library users. And I'm looking to welcome back more library users as we go. And we've actually surpassed the 6 million number, which we might touch on later on, of library visits, virtual and physical, as at the end of the year. So something to be proud of when we are looking at some of the things that maybe we might have done slightly differently. Who knows?
Okay, thanks, Terry. Thank you. Okay, so as I said, I'm moving on to community protection, public health resources, etc. You've covered libraries. Stephen, you have something on waste sites, I understand, and then I'll come to you, Judy.
Yeah, just briefly. I wanted to echo some other issues here on waste sites, which has been operated amazingly well, and the work that Matthew King and his team have undertaken in getting the household waste sites up and running, the work of the staff, and actually particularly, and this is the parallel with the other item on highways, how that we have been regularly kept informed of the issues and were consulted about the processes to start with, and as a result of which it's worked very well. And again, I think it's a tribute to the staff. They managed to operate successfully traffic management controls on the roads which some private operators, and I'll name one, McDonald's, have been an absolute disaster at in the case of Watford. And I think it's a tribute to the hard work the staff put on this. And I'm particularly pleased, I'm sure others are, the regular updates we're getting about what the situation is. So a tribute to the staff and the hard work they put in there, Teresa.
Thank you very much. Judy.
Thank you very much. I don't know why Terry should be so tetchy with me about libraries, because I've never criticised Hertfordshire's libraries for a second. I was in fact going to ask him, before that litany of loveliness, under 8.10.1, whether, because again these papers are written several weeks before our meetings, whether he could give us an update about subsets of libraries opening in key locations, because it's all very exciting and positive.
Thank you, Judy. Terry.
I can't give you specific details, but we're hoping that within the third phase, which we're expecting in July from central government, we hope and we rather expect that they will allow libraries to reopen. We will have to do this in a coordinated approach, and probably starting with our larger libraries, and then moving on to the community libraries. We have to recognise also that within the community libraries, a good number of our volunteers may well be in a category of age or health, who may not actually be able to get out to operate the community library. So we have to be aware of that. And that's actually, if I may take a slight tangent, just going back to the libraries for a second, obviously, as soon as we know what the position is, we will let all members know, and indeed the wider public, because we are very keen to get people back into our libraries and using the library facilities in a physical way. The other thing, I think, also just picking up the point from the community libraries, is there was a reference earlier on to the number of volunteers that we have, and I hope that we may be, in the fullness of time, be able to convert some of those volunteers to actually taking up volunteering posts within libraries, community libraries and other facilities that we've got around the county, so that their opportunity to volunteer will not be lost.
Okay, fine. Thank you very much. Does anybody else have anything else to ask in relation to the rest of the paper, please, before we move to the recommendations? No? Okay, thank you very much. Okay, so
Sorry.
we have...
Sorry, Terry, were you rushing through the last few items on that, including the finance report?
No, I'm not rushing. I said, does anybody have any further comments on the rest of the paper?
Okay, the finance report, I've got a couple of questions for Scott, if I may.
Okay.
I just wanted to provide him with the opportunity of letting us know how we are responding to the national situation in terms of additional funding from the government, and making sure that we're covering our cost profile in terms of COVID. My question for him is in relation to the Delta returns. We've made 2 Delta returns now to central government on the COVID costs, and I'm sure we are preparing for the 3rd. I just want him to be able to emphasise how we're covering those issues. And on the revenue side, I know that we are very concerned, and the paper highlights the concerns relating to our receipt of rates from both commercial and from residential perspective. And I wanted to make sure that he had the opportunity of giving us of covering the national guidance in terms of where these returns in relation to potential losses on rates are meant to be held, and how we are helping the districts and boroughs in supporting them in making representations to central government on that subject.
Okay, fine, thank you. Yes, so you've moved on to item 11. Sorry. Okay, so Scott, have you got all that?
Yes, Chair. Thank you. Okay, so since we last met, a further tranche of funding has been made available to the County Council. Just to remind members that there's been two tranches of money, two £1.6 billion that have been made available, given a total funding package of £3.2 billion to local government in meeting its impacts of COVID. For the County Council, our first tranche was equal 26 million, but then the basis in which the funding was allocated for the second tranche changed, which I use the word favoured district councils, but it just reflected more of the challenges that they are facing in relation to their income streams. So the formula changed to reflect that, and as a result of that, there was a reduction to the county councils, and including ourselves, our allocation reduced down to 22 million. But for Hertfordshire as a whole, we received a larger proportion of the 1.6 billion across the whole of Hertfordshire when you take the boroughs and districts and the county into account. So in total, we've received just shy of £48 million worth of funding from the government. We have provided two returns to government now that have outlined the pressures as we see them. The government has asked us to try to improve the consistency across the sector in the way that we present that information. So there was much more guidance on the period that we should be forecasting our assessments and forecasts on, which things that we should include and what we shouldn't include, such as council tax losses should be reflected by the districts and boroughs rather than the county council. So as a result of that, we've identified that our pressures have risen from 35 million that we identified in return 1 up to now 64 million in return 2. And there's a range of different factors that's covered in the report, which I'm more than happy to take any questions on, but is detailed in there, such as things like increased costs of PPE, for instance, increased losses on some of our income streams. So that would identify that we would have £17 million worth of increased cost over and above the funding that we've received so far. The guidance that I'm hearing from government at the moment, although not yet confirmed, is as the government won't be allocating like further just tranches of money as it has, but providing a system that will be starting to underpin the finances of councils going forward, and the design of that is currently in progress. So as far as districts and boroughs are concerned, we are speaking on a weekly basis and keeping in touch with each of the chief finance officers in all of our districts and boroughs, and where any authority is finding that they are struggling with tax yields and collection being made within their locality, we are talking to them and asking get an understanding of their cash position and their ability to be able to meet their preset payments to the county council. If and when there is a situation where they are believing that they will be short and not be able to meet their preset payment, then we would then be looking to go with that local authority and the Police and Crime Commissioner, as guided by the MHCLG, to talk to them in the first instance about any sort of interim measures that can be put in place until the national system and the approach that government is currently working on is put into play. So that would be our response to any situation with any district that is struggling to meet their preset payments, is that we would join with them and the Police and Crime Commission to make appropriate representations to the MHCLG, so our local taxpayers are not unduly affected by this current situation. Thank you, Chair.
Okay, thank you, Scott. Is that what you wanted covered, Ralph? Have you got anything else? Microphone.
The microphone turned itself off, it would appear, its own in this situation. Yeah, I wanted to give Scott the opportunity to just outline where we were in relation to our cost profile and our response to the local authorities' concerns over their collection funds, and make sure that there is an avenue back into central government through MHCLG where we are going to make a strong representation in relation to those two issues.
Okay, fine. Thank you very much for that. Okay, colleagues, are there any more questions, queries, observations on this the COVID response paper? Quick one, Stephen?
Yeah, it was just on that because no doubt, like Ralph, he's been on various conference calls across the country. Some councils are proposing to introduce emergency budgets in terms of their expected deficit in September. And could Ralph, as obviously the finance lead, give an indication as to what would be forthcoming, not necessarily emergency budget, but in terms of what is now identified as a potential deficit on what was the original budget, i.e. the 17 million that's been alluded to by Scott, and when we'll have any reports forthcoming on what we may or may not have to do if, and obviously we'd like to see more money from the government, if the government doesn't come up with the money.
Thanks, Stephen. An interesting question. The situation is that over the next 4 to 6 weeks, we're going to be engaging with all the council departments in reviewing their current budget position and the impact that the COVID situation has had on their cost profile and their ability to produce the savings programs that we have built into our IP projections going forward. Once that's undertaken and we can see a position in relation to the outcome or projected outcomes on our existing budget, that will be the time when we will make a review of the necessity, if at all, to look at an interim budget. I'm not hearing any feedback from officers in the finance team that they are proposing that there will be a need for an interim budget. Clearly, the reaction from central government in terms of supporting local government will be important. And as Scott has suggested, there is a plan being worked on at the moment. And until we know what that is, clearly we won't want to run before we can walk in the situation. So the next 4 to 6 weeks will see us through a review process, at which time we will then be ensuring that any future decisions are well researched and measured.
Okay, thanks, Ralph. Mark Watkin.
Can I just have an assurance on that in terms of future decisions, if we're having to take them, they will come back into the public frame either at a special cabinet panel or other cabinet panels before those decisions are made, if there has to be change?
I'm sure that the fact, if we want to change the budget, then we have to do so through an appropriate process. And I'm sure as and when we get to the point that we are in a position to make considerations of changes that need to be made, the opportunity to have briefings from the finance team, from any paper that's issued, will be made available to yourselves, and it will have to come back through this and on to cabinet if we make any decisions that are going to affect the overall position, and I think go through to council if that's the case.
Okay, thank you. Mark Watkin.
Thank you, Terry. I just wanted to pick up the point on the table showing where's this 11.3.3, where the services are illustrated with their expenditure, and the extraordinary figures, I see it, of virtually £9 million worth of risk associated with children's services. So effectively, it could be children's services could move from 9 million total spend to 18 million. I mean, the projection is 18 million. I just want to get a view of officers of what that risk element is. Is it a very high certainty? Is it the worst possible scenario? I just want to get a flavour of it, because it stands out on that table as being the biggest question, of which is we don't know the answer. So some comments now would be really helpful.
Okay, so I can comment on that, but obviously officers, I'm not sure who's on the call, actually can put me right. I know that officers have been looking at the worst case scenario, absolutely worst case scenario, and they've done some projections until September. But I don't know who's on the call that can confirm or deny or add to that, please.
Chair Stephen Pillsworth is on the call and may be able to provide a bit more detail that you're looking for.
Okay, if you've got the children's service details, Stephen.
Will do. Thank you, Scott. Thank you, Chair. So in the area of children's services and those items we're flagging as risk, it effectively covers two areas. Firstly, the possibility that for children we are currently caring for, those placements might break down because those independent providers or foster carers might be shielding or maybe contracted COVID and then are unable to care for those children, and they may end up in more expensive placements. The incidence of that so far seems to be low, but that is still a possibility as we move forward. The second issue that we're raising as a possible risk is actually, I think as a lot of people are aware, the referrals into social care at the moment are very low, mainly down to the fact that children are not within their school settings where a lot of issues are picked up and refer into social care. And we're expecting, as children return back, that we may well see an increase in referrals coming in and an increased requirement to look after some vulnerable children. Now, what we don't know is, ordinarily, we would have looked to intervene early and put some preventative measures and early support in. It may be because of the lockdown period and some of those referrals coming in later, the amount of intervention and support we need to do is higher than what might otherwise be the case. Now, clearly, both of those elements are very uncertain and very difficult to predict. So really, we've not been able to do too much more than an assumption across the number of children we currently have in care and a proportion of those requiring more expensive placements. So it has been very difficult to estimate. I would always hope we've taken a prudent view in that. But equally, I don't think finance officers ever use the phrase worst case scenario. To some extent, things could be worse than we've got in there, but we will monitor that very closely. We obviously have good processes in place for monitoring numbers of children coming into care through our monthly processes anyway, and we'll make sure that every monthly financial monitor we do, that's an area where we're looking at those trends very carefully and closely. Thank you, Chair.
So, Mark, if I could just add, because you'll understand this one, obviously we don't know where the children are going to come from, but the SASH team, the adolescent team that we've got now, are out seeing their young people, trying to keep them in their homes. That's been going on through the whole pandemic. And actually, children's placements have become much more stable. The children have actually liked not having other distractions around like school, because they don't all get on with school. So we've actually had quite a stable time, and that's why there is this degree of concern. It'd be nice to think that the stability could carry on, but it's quite unlikely. So you realise it's a very unknown environment with young people. I know Stephen doesn't like worst case scenario, but I can assure you the projections that they've looked at on referrals, etc., are worst case scenarios. So I had that briefing yesterday. I hope that helps for now.
Yes, can I just make a very quick comment? Now, I've also had a very good briefing from Marion, so I've seen very much the figures you're talking about. And I think the question lies really on how quickly secondary schools actually get up to speed. Will they be able to operate fully, and for how long and when? But I absolutely get the point, and it's really about that risk factor and the unknown. My fear is actually that those figures may take longer to come through the system. That's really what I'm concerned. Okay, thank you.
That's quite right. Thank you very much. Okay, colleagues, I'm now going to move to the recommendation. Can I ask Stephen if you could formally put your amendment? I think you've said enough around it, but if you could just formally put it, and then if I could have a seconder for that amendment.
Okay, maybe if you speed it up, and as we've tabled them, can you assume that all of them are formally put at some stage?
Okay.
You'll speed things up later. Chair Teresa, I thought I formally move. That's the case. Yes.
Thank you. Could I have a seconder, please?
I'll second.
Thank you, Mark. I'm not going to invite debate or comments. I think we've done that. So I'm now going to ask you to vote on the amendment on the chat bar, which I'll read it again. The amendment is, furthermore, adding to the recommendation, Furthermore, sadly, due to the reported higher than normal level of deaths in Hertfordshire care settings, request the Cabinet to undertake a full independent inquiry into the management of COVID-19 in the care sector in Hertfordshire once the crisis is under control. So could I ask members to vote for, against or abstain? And could I ask officers to let me know what the decision is, please? Have you all voted? Okay, well, I think it's against, but can officers confirm, please? Right, so I think Judy said earlier that you were abstain. If you want to do something different, Judy, can you just stick your hand up? Are you happy with abstain? I think you are.
I'm happy with abstain, yeah.
Yes, thank you very much. Okay, so that motion, that amendment has been lost. So I now go to the substantive recommendation, and that is that the panel notes the contents of this report, including the planned approach to dealing with the financial implications. All those in favour, please show. Do I assume that everybody else is either abstain or against? I think I am, so that motion is carried. Well, that recommendation is carried. Thank you. Now, the time is 12:06. I'm going to suggest that we have a 5-minute break, okay? Shall we say we're back by 12:12, if that's okay? Thank you very much.
And thank you, Teresa. I felt you chaired that
again. Officers are just alerting IT. Okay, are we ready? Okay, we've restarted, so thank you. Thank you very much, everybody. That was a good debate this morning. So now we move on to the rest of the agenda. Moving swiftly on, as it were, to item 3, Hertfordshire County Council's Performance Monitor Quarter 4 for 2019-2020. It all seems such a long time ago, doesn't it? Alex James, Head of Corporate Policy, and Martin Aust, Head of Intelligence, Improvement and Technology and Resources, will be presenting or available for questions. So not sure who's going to come up first, please.
Hello, Chair. That would be me.
Alex.
Good afternoon, everybody. Hi there. And yes, the report compiled by Martin and I know Martin's listening in, but I'm not sure he's actually on the call to answer any questions. But nonetheless, that will help us pick anything up. First thing to say is I've got a short presentation I'm hoping to share with you. Sorry. So if you bear with me just a moment, I will hopefully be able to share my screen. If I could check whether members are able to see that at all.
Yes, I can. So I'm assuming everybody else can.
Yeah, great. Fantastic. Then I'll start. And as mentioned, this report, and sorry, just to say, the slides are also been sent around by email as well. So hopefully that will help kind of aid you having a look at the presentation. As mentioned, this report is the Council's overall performance report for Quarter 4 of 2019-20, which normally would go to the Resources and Performance Cabinet panel, but obviously coming to this panel instead. It covers the period of January to March 2020, which clearly for its most part was before the main COVID pandemic hit. So while there are some references to COVID in the report, in many cases we will have to wait until the Quarter 1 report to see the full impact starting to be reflected. Nonetheless, we feel this report will hopefully provide a useful baseline of where we were when considering the Quarter 1 report as well. That said, there are a few sections where COVID-19 can be seen to be starting to have an impact. First of all, if you look at section 1, percentage of older people at home 91 days after leaving hospital into re-ablement, there is a decline in performance in this area during Quarter 4, and it is fair to say, unfortunately, by the end of the quarter, the number of deceased people in this category was seeing an increase up to 37% compared to the same period last year. So it is felt that clearly that is starting to show some of the impacts of COVID towards the end of Quarter 4. On a different note, in terms of the community protection side, so section 4, we do also see the number of fire and rescue volunteer hours and indeed safe and well visits begin to reduce as once again as a direct result of the pandemic. That's both in terms of capacity with officers and volunteers being directed elsewhere, but clearly in terms of the visits, much less capacity or opportunity for people to go into people's houses and conduct those visits. On the flip side, and I know it's libraries and visits has already been mentioned in today's meeting, we do know that library online visits did increase quite considerably during Quarter 4. We do know the service was on target for a positive year in terms of overall visits in any case, but clearly that was tempered by the COVID pandemic, not least, of course, by the closure of all the library buildings towards the end of March. But as already been mentioned, in terms of that end of March and indeed increasing into sort of April, May and beyond, we have seen an increase of online visits, I'm sure in reaction to that as well. The report also includes a number of updates on key projects which mention the likely impact of the pandemic on their progress. This includes the updates on the externalisation of the music service, the development of the fostering strategy, and also the school expansion programmes as well. So that's kind of where we are in terms of the COVID impacts in the Quarter 4 report. I'd also like to bring your attention to a few other highlights elsewhere in the report. starting with the adult care and health section, which is section 1. First thing to say, delayed transfers of care, especially those attributable to social care, did stay stable during this period, although clearly something to keep an eye on, as I say, in terms of when we move to Q1 and beyond. This quarter also saw an increase in the percentage of repeat incidents of domestic abuse, rising to 34.5% in Q4 compared to 31.35% in Q3. This does reflect a gradual rising trend over time, and as the report says, continuity plans were put in place in response to COVID, with a number of repeat cases expected to increase during the crisis. And once again, as we've heard already today, clearly a real key concern around that sort of area and something to keep an eye on and to monitor. Moving on to children, young people and families. First thing to say, a new indicator was added to this section, section 2, which provides the data on the presenting needs identified in family groups that are assessed as part of the Family First assessment. As you'll see, the highest presenting needs relate to mental health. They're followed then by domestic abuse and education attendance. The report also continues to show the increasing demand for education, health and care plans, which we've seen a year-on-year increase this year, with 20% more requests received compared to 2018-19 and 25% more plans issued during that in 2019-20 compared to the previous year. On to community safety and waste management. Q4 did see positive progress on most fire indicators. As you'll see, the number of primary and secondary fires are both at their lowest levels for the last 2 years. Deliberate fires have also decreased and attendance standards continue to improve. The report does show, however, a marked increase in primary fire injuries in Q4, with 27 injuries recorded compared to 17 in Q4 of the previous year, 2018-19. This is currently under investigation and clearly will need to be monitored to see if this is a blip in the data or whether it's a continuing trend. Highways and environment, the percentage of schemes delivered against the Integrated Works programme was down to 74% at the end of Q4. That's down from 81% in Q3. This is mainly due to some movement in the Bridges programme and also the Integrated Transport Projects post-work activities. I also understand there was a delay in updating the A-Roads programme information following the Christmas break. If I may at this point also just highlight a slight or an error in the report on page 29, that's section 6.2 around ringway performance. This should read basically that this quarter's performance of 96.15% is a small increase on contract performance compared to Q4 of 2018-19. That increase, in fact, is actually 0.08% as opposed to 0.8%. Just to clarify that particular point. Education, libraries and localism. This Q4 report, as ever, includes performance on this year's school place allocation process and shows positive progress on both primary and secondary figures. In terms of primary schools, the percentage of children not receiving a place at a ranked school improved by going down to 2.47% this year compared to 2.68% in 18-19. And there was a bigger reduction, a positive reduction in secondary schools, with the percentage of children not receiving a place at a ranked school improving to 4.47% compared to 6.92% last year. And finally, moving to resources and performance, just to mention average sickness absence per employee. These figures for Q4 are based upon a rolling year to February 2020, so as a kind of before the COVID pandemic. But at this point, sickness absent had remained level at 7.1 days, which is very close to the County Council's overall target of 7 days average per employee. But included here clearly to say this is another indicator to keep an eye on for Q1, given obviously what's all that's going on. The report also provides an update against the apprenticeship levy and the council's use of that. This shows the positive news that the council very almost reached its target of recruiting 184 apprentices for 1920. They in fact recruited, or we in fact recruited 181 apprentices, and I also understand a further 90 apprentices have been identified to start in 2021 as well. This means at the end of 1920, the council was able to use most or a very large proportion of its levy for the use of HCC purposes for apprenticeships for county council staff. But as the report mentions, there has been a small amount. I understand it's about 3% of the overall council's levy so far has been returned to the government because it hasn't been able to be spent in the 24 months that it was available to be used for that purpose. That's where I will leave it, but very obviously happy to take comments, questions and so on. And I'll end, if I may, by returning my screen to non-sharing.
Thank you, Alex. Okay. Are there any? So actually, first of all, I'm going to ask Ralph Sangster, do you want to make any comments at the moment?
Sorry, just coming in. Hopefully I'm up and running now. Yeah, no, I don't have any specific comments to make. I think the issues that this report reflects on have significantly changed since this report was prepared, and we are looking at trying to capture some of the faster moving data that is relating to COVID in a shorter and more frequent report that's going to be that hopefully will come to this panel on a more frequent basis. That's been looked into by our team, and we're hoping to provide some useful information at the next meeting, but a more expanded one on the meeting up thereafter.
Okay, fine, thank you. Stephen.
Thanks for that. Yes, because this is a pre-COVID report, so to some extent it's historic and it's a baseline. And thanks, Alex, for correcting the bit I spotted on the highways one, as you might imagine, and the clarification that the figures were a different year and different percentage. But going back to page 4 of 44, there's the £148,000 given back to the government of the apprenticeship levy. It's always disappointing to give money back to the government when they're giving it to us. Just some clarification as to why that's occurred, please, because obviously, whilst I appreciate we've done our best or as best as we can with apprenticeship, that must be equivalent to quite a few potential apprenticeships we could have had within Hertfordshire. And I noted obviously on the works programme the decline down from 81% to 74% on Ringway integrated works, obviously historic, and obviously that figure is now going to be completely skewed with social distancing and works for any future quarters. So we'll probably need to have some different benchmarks or bench lines for some of these items because of the social distancing, and obviously officers will need to explain how that's going to work at some stage, not necessarily now, Chair, but at some stage.
Okay, so Alex, are you able to comment on apprenticeships, and if anybody wants to comment on initial benchmarking for the future, just quickly, not a long one. Okay.
Thank you. I'm not sure if anyone else is more qualified to speak about the apprenticeship levy, so I'm not sure I'll be able to answer all of Stephen's answer, but I do know that basically the County Council and all of our organisations have 24 months to spend what they've given in terms of the levy, and it gets sort of chopped off after every 24 after each month starts to reduce.
Okay, that's fine, thank you. So actually Ralph can answer that one. So Ralph, can you respond to apprenticeships?
Yes, thank you, Chair. The situation on apprenticeships is that this represents the first 24-month period since the scheme commenced, and most of the councils and participants had a fairly slow start. They were starting from a position where the arrangements in relation to apprenticeships was just being established. the availability of recognised schemes that were capable of being included were limited. And in fact, the assistant director for HR was instrumental in producing or evolving a scheme with Hertfordshire University and others in establishing these new opportunities. And I'm sure that one will recognise the fact that I think it was considered an exemplar opportunity by central government to Hertfordshire's proposals was exemplar in terms of its establishing these proposals. And this is kind of a hangover from those initial start date when we were ramping up the opportunities for apprenticeships to be established. And I think going forward, we will find that the ability to fill those spaces and to use up all the levy will be much more will be certainly more improved than it was from that very early start. And I think that's the reason why we've had hand to hand back a small sum of money, but I'm sure we'll be hanging on to it in the future.
Okay, so obviously COVID will have an impact anyway, but so we'll have to wait and see there, won't we?
I think that the Alex was pointing out that we've already established there are 90 apprenticeships already established for this coming period, and hopefully that will be supplemented by a sufficient number to gain back or to hold on to all of the levy that's being made available for us in the future.
Thank you. I missed that one. Thank you. Phil? You want to comment on benchmark?
I noticed Tony's asking to come in, so he might have more of an update. But generally speaking, it's a good point from Steve about benchmarking actually reflecting what's possible on the ground. I mean, highways are hoping to do the majority of planned works, but so with all these other schemes that we're having to put in place as well, we cannot guarantee that we will do. And I've asked people already to go away and actually reduce our targets in line with what our realistic expectations are.
Okay, thank you. Anthony? So Anthony's head of highways, Anthony Boucher.
Hello, thank you, Chair. Just to add to what Phil has said, that we were planning on reviewing our benchmarks for highways this year anyway, and we'll have to do that even more so now with the response to COVID. And the measure that Councillor Medhurst looked at and commented on is an odd one in that it looks at programme reliability, which is the entire delivery of a scheme from feasibility right through to final accounts being delivered. That's different from the performance on the integrated works programme, which is how many schemes have actually been delivered. They're subtly different measures, but we can cover that at another time offline if you prefer.
Thank you. Richard, is your comment on the same subject?
Teresa, I was going to comment on the ever so briefly actually on the ACS section.
Okay, can we just see that is there Stephen, we've responded to your queries, have we not?
Yeah, I'm quite happy to have a discussion with Mark in future so we can work collaboratively what will be realistic targets and where we have to change programs around, which
okay, that's great. So Richard, over to you.
Thank you, Teresa. I just want to come back quickly. 8.1.6 shows the graph for the apprenticeships and appears to show a massive improvement over the last quarter in terms of the number of apprenticeships. So never mind what we've had to send back to government in terms financially, it is great to see that we've got a large number of apprenticeships taking place. We also, through HCPA, Hertfordshire Care Providers Association, during this pandemic, have recruited a significant number of people to enable care homes to keep staffing up. And I think those two things are, to some extent, linked. Certainly the drive to make sure that we've got the right staff in the right place. And again, just as it's more of a general comment, but well done our staff for stepping up to the plate during this period. It's not reflected in this particular quarter's performance, but I happen to know from the director that our agency spend at the moment is some of the lowest we've ever had in ACS, and that's great because that says that staff are coming into work And there's no swinging of the lead there. So I'm really grateful to everybody across the care sector for their efforts here. The only thing I did want to mention from the report was around delayed transfers, discharge from hospital. I think because of the really good work there by the teams, both at Lister and at Watford and our other hospitals like Chase Barnet, for example, that of really making sure that the care needs are not holding up discharge from hospital stood us in good stead when COVID came along, and we were able to work with our NHS colleagues really well to make sure that people were taken out of hospital and then cared for appropriately. So thank you, Teresa. Thank you.
Okay, thank you. Yes, if I may also just to highlight the new families first indicator that you're now looking at, reflecting the various issues that our early intervention teams are having to deal with. That's really important for ongoing work and has helped incredibly with dealing with COVID, actually, because of the Families First work, we are working with multiple partners, and we've been able to respond efficiently to those issues that have come up to hit us. So again, like Richard, I'd like to take the opportunity to thank all of our children's services staff, not just social workers, but everybody for the work they've put in recently. Is there anything else on the performance monitor? Terry, music service.
Yes, I just wanted to pick up the fact that on the monitor, the music service is showing as a red because of the delay in the externalisation of the service. I have to say the music service has adapted absolutely fantastically to life under lockdown, and they've produced a whole range of new facilities which will help to reduce the losses that they are inevitably going to incur in the next year. But suffice to say, it's right that we should look after our music service and assist them along the way. And for that reason, at the moment, the externalisation progress is on a hold basis.
Okay, thank you very much indeed. Is there anything else anybody wants to raise on the performance monitor? No, nothing's come up. In that case, I will move the recommendations from the chair. They are set out in your agenda. Please could you indicate in the chat bar for, against or abstain? Thank you. Okay, well, we've got a majority there, so thank you very much, colleagues. Okay, moving on to item 4, which is the highway locality budget to 2021 county council election. So I haven't got Richard Jones, I've got Anthony Boucher. So Anthony, again, head of highways, you are going to present this report.
Yes, thank you very much, Chair. And Richard Jones, our Group Manager who administers the highways locality budgets, also on the call.
Okay.
So is available to answer any questions.
Okay.
This paper is about how the highways locality budget will operate in 21-22, with the elections in mind in May 2021. The proposal is to operate the highways locality budget as it was run in previous election years in 2013 and 2017. Broadly, what the paper outlines is that the incumbent member can direct up to £77,000 for 21-22, predominantly capital, but there can be a mix of revenue and capital. So that's what the incumbent member does. The newly elected member cannot redirect those funds in 21-22, but the newly elected members provided with £13,000 of revenue funding for the year in which they're elected.
Okay, simple. This is, I should say, this has actually happened in the past as well. So Phil Bibby, did you want to make any comments before I open the floor?
Yes, thanks, Chair. Just to reinforce what Tony says. This is something that we do every 4 years to make it fair and coherent as to responsibilities and powers of outgoing members and the like with incoming members. So it's really just basically a format we have to go through every 4 years. It's tried and tested, and I don't think there's ever been any real dissent on it. But
okay, thank you. Okay, is there any debate, please? Please, could you indicate in the chat bar if you wish to make a comment? Stephen?
Sorry, I inadvertently turned my mic off. I don't know if you called me. It was just Teresa, it's Stephen. Yes, there's no issue on this from our side. I just felt the appendix could have been slightly, the funding option should be slightly clearer, because you can spend, say, 60,000 on capital and then 63,000 on capital and 13,000 on revenue, but it's the maximum 77. It's what we agreed the last 2 election cycles, so it's fine.
Okay, thank you. Asif?
Yeah, in principle, there's no problem here. Just wanted clarification about those projects that were delayed through COVID that have already been put in, and whether they will be implemented in this financial year, or if anything can linger over into the next financial year. So about monies that have already been put into projects that have existed.
Okay. Anthony, can you respond to that at all, or Richard?
Yes, we're working through the Integrated Works programme at the moment, and we're trying to deliver everything that was in the IWP this year. We can't be certain yet how that's going to work, and then we need to have conversations with our colleagues in finance about what we do with schemes that haven't been able to be delivered this year, and whether we can passport the money in the scheme over to next year. Our intention is that schemes would move to next year if we're unable to deliver them this year.
Yeah, okay. So we keep everything crossed then, basically, hopefully. Judy?
Yeah, I just wanted to say that in effect, I was one of those in 2013, with a gap of a few months for obvious reasons, that took over the schemes of a political opponent in Ray Shakespeare Smith had set the parameters, and it really wasn't a problem at all. So I think at this sort of level with these sorts of schemes, we just go ahead as it's been done before.
Great, yeah. I mean, it's all about locality, isn't it? It's local stuff. Yeah, so that's good. Okay, is there any more debate on that? Okay, so the recommendation is the panel is asked to recommend to Cabinet that Cabinet agrees the proposed arrangement for HLB to cater for the 2021 election as set out in section 5 of this report. All those in favour, please show. Against or abstain. Yeah, so that's passed. Thank you very much. Now on to the next nitty-gritty, a knotty subject, the speed management strategy, colleagues. I believe we have Rupert Thacker, Head of Highways and Implementation and Strategy. Oh no, do we have Sue who's going to present? Well, we've got you both.
Yeah, both of us. So I was going to present, but Sue's here for if there's any really nitty gritty in terms of the detail as we go through it, because she's been looking after the final authoring of the speed management strategy draft that's been presented.
Lovely.
So I'll introduce it just briefly. As you're aware, we've had the current speed management strategy since 2014. Quite a lot's moved on at a national context in terms of people's view on how speed limits should be administered, although the DFT guidance is still 0113, which dates it to a year preceding that last draft. We've sought to incorporate views and changes around 20 mile an hour areas particularly, but also sought to clarify the setting of local speed limits and how they are interpreted by drivers as one of the underlying principles of how this strategy should be set. It's been through a couple of member advisory group sessions to take members through that thinking and to bring them on board with the approach, and it also takes on board the place and movement analysis and process that was adopted at previous panel a couple of months ago. So that's now been worked into the speed management strategy and is one of the key ways in which we help to identify appropriate speed limits in locations. I'll leave it there, and we're happy to take any questions in advance of it being approved for consultation over the summer.
Yeah, okay, fine, thank you. Questions, colleagues? I can't believe there aren't any questions. Judy.
On my iPad, it's impossible to say I want to ask a question and deal with the camera and microphone at the same time. I've been a member of the MAG. I haven't understood probably more than 50% of the words when it comes to the technicality of these things, and those I probably haven't understood in the right order. But I was interested to hear Rupert just say that those meetings were to help members through the thinking. I thought they were also to get our views, but have we been badly conned on that one?
No, sorry, maybe I misinterpreted. It's very much the both. I think it was to explain our thinking and to see if you were on board with it in advance of it going into the strategy. That was exactly the process we were trying to take it through.
Well, I'm absolutely on board with anything that enables us to introduce further 20-mile-an-hour areas. I'll use the right language, but do worry terribly on my own turf about the lack of controlling it afterwards, because we can have words in papers about self-enforceable places, but there are always drivers who will refuse to do it, and in those cases we do need enforcement. That's all I'll say.
Okay, thanks.
I think if I can come in on that one. So what the strategy tries to do is set a sort of clear framework for the types of sort of situations where it, would be appropriate to introduce these sort of 20-mile-an-hour areas. So, I mean, the fundamental principle is that the road environment needs to be correct. So drivers, kind of naturally self-comply with the sort of speed limits where possible. And the importance of things like understanding the sort of current speeds drivers are sort of travelling at, the local environment of the road. So, for example, if there's active sort of frontage, the width of the road, sort of how many junctions are along it. So it's kind of very much sort of trying to say that we will introduce, we'll be prepared to support the introduction of 20-mile-an-hour limits, but the environment and the area needs to be appropriate to encourage that self-compliance.
Yeah, thank you. I'm sorry, Phil. I should have asked you to come in and comment initially. Sorry, do come in.
No problem. I won't repeat what my officers have said because they've covered the main points. The only thing I will come back on perhaps is the enforcement, and as we know that's a police function, but we do work closely with the PCC and his road safety fund for him to help. He's actually providing more what do you call them, speed vans, the vans parked on the side of the road to help. In the speed management strategy, we would like to add the ability to install average speed cameras in appropriate circumstances. And obviously, if we can't justify that with our KSIs, etc., we would like to work with the PCC for him or his team to actually provide average speed cameras through the Road Safety Fund. We're trying to work up a memorandum of understanding between us to find out how these would be worked and maintained, etc. But I suppose that's the main new thing to this this strategy, in that we want to actually provide more enforcement capability.
Okay, fine. Thank you, Phil. So I have got Asif, Stephen, Richard, Eric, Steve and Mark. So if I forget to call somebody, please remind me. So Asif.
Thank you. I've read this strategy in detail, and thank you for doing that. For me as a local member, and another feedback I'm getting from other areas, from other Labour members, it's about three things in particular that we need to get over in trying to implement the 20-mile-per-hour zones. Speeding up the process. It takes a long time of actually getting these 20-mile-per-hour zones in place at the right time. And I think one of the key things that the strategy needs to implement is reducing of the costs of implementing these. So as local members, we usually use our highways locality budget to implement the 20 miles per hour zones in particular areas. So if the strategy ensures, as Judy and others mentioned, that enforcing through the police happens in 20 mile per hour zones, that's great. Speeding up the process of implementing 20 mile per hour zones and reduction of the costs. I think if that strategy can implement those three things, I'll be very, very pleased.
Okay, thanks, Rupert.
I think the strategy aims to provide clarity on the requirements around 20s that I would hope would make it quicker in terms of their assessment and ability to be implemented. What it won't do is make it necessarily quicker for the process to go through, because that's governed by the traffic regulation order and consultations that need to be undertaken to support these measures when they're introduced. And as I'm sure members are aware, there's often mixed views over the implementation of them, particularly if they're accompanied by the various traffic calming options that sometimes need to be part of the project. But certainly the steer on whether or not a location is appropriate should be able to be made more quickly.
Okay, and reduction of cost to members?
Well, and again, this is very much dependent on the location that members are seeking for a 20 to be implemented, but where the measurements have been taken and the speeds are in keeping with the requirements of the 20 mile an hour area, the costs will be low, and it's a matter of signage and the traffic regulation order. Where the speeds are higher than those that the strategy sets out, that's obviously where the costs start to come in, because measures would need to be considered as to, and appropriate measures considered, that would bring them into self-enforcement and how that's achieved. And again, that is very much an ask of Herts Constabulary, that 20s in particular are self-enforcing. They would not want us to be considering the use of cameras or other methods to enforce on those, and certainly not a call on their resources. They want them to be self-enforcing through their own engineered state.
Yeah, okay. Is that all right, Asif?
It is. It's, you know, I'm not saying that we shouldn't be doing consultations and going through that process. It's just, in fact, it takes years for 20 miles per hour zones to be implemented after concerns are raised, and that process itself is what I'm talking about. In terms of, again, costs, it's working together across, for example, Watford, or working together with other divisions and getting those costs reduced. You know, the cost of organising surveys and consultations, for example, I'm just, sometimes my jaw drops. But anyhow, if that process does help in reduction costs, I'll be happy.
Okay, all right, something we bear in mind. Stephen.
Thank you. I welcome this, because this has been a long time coming, and obviously was somewhat delayed, and understandably so, by the place and movement strategy that backs this up as a document, which indicates the type of roads where we can. I mean, obviously, it's more than just 20 mile an hour. The speed management strategy, it covers all other aspects as well. So let's not forget that. And indeed, in some areas, some residents want 40 mile an hour roads drop back to 30, and the place and movement strategy may be able to support that. So I mean, that's another issue that's buried within, not buried, is part of this. So I thank the officers for what they've done. If I can at this stage, and I'll speak to it briefly and then cover the rest of all of this, I don't need to come back again, I hope, Teresa. I've made a minor amendment to the recommendation, which just basically replaces the words "the political process in autumn 2020" by putting a clearer time frame on it. And it either comes back to a special cabinet panel, or hopefully, if we're back to in September, to normal panels, the Highways and Environment panel. The reason for that is twofold. One is it makes it very clear that we are consulting during the summer, and it will come back then, because then, having got it adopted with any changes that may be the case, a special cabinet panel or Highways and Environment, it will have to go back to cabinet and potentially go back to full council. And what I don't want is to slip out of the time frame of the items we've just discussed in terms of the highways locality budget. So it will give the opportunity of members, if they so wish, in conjunction with other members, as Asif has just said, because we're very keen in Watford, and that's across parties, to have area 20 mile an hour limits. to get together and say, actually, we can now do this. We've had this assessed. Let's allocate some money for the next financial year before we get to February 2021. So that's the reason for putting in that time frame, so we don't miss the opportunity of using the next financial year. There's no other reason for it, but I hope, therefore, on that basis, Teresa, you and Phil will be able to agree to that slight amendment, makes it very clear the process we need to go through. As a member which has, I think, 70% of my division covered by 20-mile-an-hour limits, because it's the town centre and neighbouring areas, I don't anticipate much more having to be done. But I think the real point these can be very, very slow processes. And if this enables us to speed up, because, and I'll use an example, and actually in Asif's division, I've used it to officers, where the roads either side of Leavesden Road are all 20 miles an hour, but Leavesden Road, which is identical to them, isn't. And had we had this in place, it could have meant the whole lot was one big area off the St Albans Road, and not having to have every single road signposted. That would be in itself a substantial saving, and actually gives it much clearer focus to people. St Albans Road, if you're able to get above 20, sometimes you can, it is the 30-mile-an-hour, but the roads all off it are 20. That's the natural default, and I think that's where we need to get to in our towns.
Okay, so Rupert, could I ask you to comment on Stephen's last comment about the Spine Road, because I've come across that as well, big problem. Yep. And then Phil, can I ask you to come back in relation to Stephen's amendment, please?
And Stephen and I discussed this very case the other day, where if the Spine Road was measured and the speeds were in line with a 20-mile-an-hour area, that wouldn't be a problem, and it could be included. Its place and movement function is correct, and the speeds are correct, and the environment's correct. It could be included, not a challenge. If the speeds were in excess of the guidance in the speed management strategy, 24-mile-an-hour mean average speed, then we would need to look at what might need to be done to help drop the speeds a little bit, so that they can, so that the environment is all of a similar type.
Yeah, so it's still difficult, I'm hearing, especially for my locality. Okay, Phil.
Yeah, I'd just like to comment on the amendment, although you haven't called for debate yet.
No, I just wanted you to comment.
Yeah, on the practical point of view, I've looked at this. I mean, obviously, I'd like, and I'm sure officers like this done and dusted as soon as possible, and I get like all members. But on a practical point of view, this decision will go to Cabinet mid-June. So the consultation cannot start until, say, the end of June, beginning of July. We've got 3 months of consultation, i.e. 12 weeks, and that will end in September, probably the end of September. So I would say it's physically impossible to bring it back through the democratic process until the start of October. I'd appreciate Rupert's view on how long it will take to analyse and tidy up the consultation to get a paper before CLG, for example. But practically, I can't see that timescale being adhered to.
Okay, thank you. Rupert, timing?
I think obviously it depends on the responses to the consultation, but knowing that 20s are a fairly emotive subject, and also there's other groups that maybe are the other side of the fence in terms of how enforcement should or shouldn't be carried out, I could see that this could be well responded to, and as such we would need a bit of time to consider those responses and to ensure that where necessary, and with Phil, we've included any amendments to the strategy. So I would suggest that it's the latter date rather than the former that would be most likely, unless we get a disappointing response to the consultation.
So are we saying October before it could come back through the political process, realistically?
I think so, yes.
Okay, thanks for those comments. Who else have I got? I have Richard Roberts.
Thank you, Chairman. I'm speaking to support this recommendation, and I guess it very much is linked to place and movement, but actually putting that into everyday language, it is having an appropriate speed, an appropriate looking and functioning high street or residential road that fits in with the way that we're going to be living our lives in the future. And I guess that's what LTP tells us. LTP4 tells us. I've currently got projects being looked at by OVARP in both Bovingdon and Kings Langley, and that's all about having a vision for what those streets are like in the future. And that's not just about 20 miles an hour, but very much by implementing a pedestrian friendly environment. 20 mile an hour is one of the outcomes from that work. And I think that's really important, that it's not the 20 mile an hour per se that's the driver. It is, what do you want your area, your community to look like? And neighbourhood plans are a really good way of bringing this into that thinking. And of course, the neighbourhood plans, that's community-wide consultation and referendum as well. So in the round, it makes sure that a whole village or a whole community is making the right decisions about what speeds they want in their place. And this helps to make that happen. So I fully welcome. Thank you.
Thank you, Richard. Eric Buckmaster.
Thank you, Chairman. I actually like strategies that are presented as frameworks, because it means we're looking at the bigger picture. And I agree with the other speakers. This is more than just about 20 miles an hour. It's about the right measures for the right place. And it isn't just for our existing communities. I think the timing is great, because there's an awful lot of growth that's going to be going on across the county in the next 20, 30 years. And I think these strategies can inform that and ensure that our future generations also have the right measures in place and at the right time. So very much in favour of this. Thank you.
Sorry, Teresa, can I just add to that as well, and picking up on Richard's point as well about, I think this is this really signals a bit of a move away from what we might have considered our traditional traffic calming techniques as well, which would be your humps and bumps, to considering a different approach to how we manage areas, enabling contraflow cycle lanes, different streetscapes that meet the demands of a new way of life for people to live in a slightly more sustainable environment. So I think, allied to how quickly we can get these things in and how much it's going to cost, it's also a slightly different approach that might be beneficial to both of those actually in the longer term.
Okay.
Well said.
Noted. Yeah, I get that one completely. My list. Stephen Jarvis. Steve.
Thank you. I think, the point that Eric makes about the impact on all the new roads that may be built in Hertfordshire, I think is an important one. We've had relatively recently built roads where some of the physical infrastructure is there, but they don't have 20 limits because they were not introduced as part of the development and planned in. And while I accept that the speed limit is only part of getting people to travel at the right speed, it is part of that. I guess the first question is, as a result of this strategy, will we be expecting developers of new residential roads not only to lay them out to keep speeds low, but also to introduce 20 mile an hour speed limits? Or are we going to find ourselves to continue to be in the situation where the speed limit part of it has to be retrofitted later at the council's expense rather than being dealt with by the developer?
Shall I just start off, Sue? So in response to that, this strategy is there to provide guidance on how you create environments that are in keeping with the speed limit you're seeking to achieve. When we're working with developers, that's a different discussion that's largely led by Roads in Herts, which we're currently updating at the moment, which will imply to them that we would be looking for much more cycle and walking friendly infrastructure to be implemented as part of new developments, and then this will help them understand what that looks like on the ground. So I think it's twofold. There's two documents that will really guide that approach to changing how developments come forward and influencing them, and obviously LTP4 that's now in place is a key tool for us to discuss with developers and planners when we're going through the process. And we are very much asking for developers to ensure that we're putting in infrastructure that supports sustainable modes of transport from the start of discussions around new developments.
Yeah.
And this is part of that.
And that includes the traffic regulation orders to support that?
Yep.
Yeah, and I say there is a section in the strategy that kind of, sets that out in black and white, that kind of, we would expect the physical design of any new residential development to kind of be based to encourage residents to kind of drive at that 20 mile an hour, and the TROs and the signage to be part of the development work. So therefore it'd be a saving for us you know.
And indeed, where it's integrating into existing communities as well, we would expect the developer to try their best and to work with us to make sure that we don't create kind of small parcels of different environments. We'd look to integrate them into a wider area. So that's where we've got asks around Section 278 or Section 106 monies to help us integrate those developments across a broader area.
Okay. Actually, while we're on that subject, can I just ask, are we ensuring that the local authorities, their local plans are making the correct reference to these sorts of strategies, or will not yet, obviously, because it's not there, but we will in the future? That's going to be quite important, isn't it?
It is, and certainly they're all, I think, now on board with LTP4 and its ask, and then when we reference the supporting documents, having these in place with an updated set of guidance is beneficial when we're having those early discussions. And having them referenced.
Okay, thank you. Okay, thanks. Mark Watkin.
Thank you, Jerry. This is more of a brief comment. I would be desperate to try and keep to achieve consistency across my division. And of course, listening to the conversation, I happen to be in a very urban environment, and I'm hearing Richard Roberts talking about villages, so I understand different needs and whatever. I'm also slightly amused by the police saying we have to be enforcing. I don't see the police enforcing 30-mile-an-hour limits, but this idea that somehow they're going to stand there and test people driving, to my mind, it's a bit of a diversion. But I think the main thing, and Rupert came out with it, and I really welcome that, is that where I have put in schemes, and some have cost a lot of money, frankly, the traditional traffic calming schemes are pointless. You know, they're very expensive. Modern cars can be driven over them at 30 miles an hour when you're trying to achieve 20 miles without any harm to the vehicle, and it depends very much on the attitude of the driver whether they are concerned or not. So I welcome the idea for more imaginative and probably lower at where roads can be made 20 mile an hour friendly, or whatever the right word might be, because I can certainly think of areas in my division which I'm crying out to make 20 mile an hour, but I'm just the costs of using the traditional traffic calming absolutely slay them, and it's frustrating for me, because I think a driver in an area like Watford should have a kind of innate understanding that when they've gone down the main roads they can go 30 miles an hour. When they turn off into subsidiary roads, they would expect those subsidiary roads to be 20 miles an hour, and therefore they're mentally conditioned to think of it like that.
Yeah, thank you. So, I mean, my comment on that very briefly, for what I'm by, we've used public health behavioural change in the recent not lockdown, but shielding of the streets. So are we assuming, Rupert, that we're going forward, we'll be using behavioural change and insight?
Certainly, and we already are to some degree with the place and movement, which is supported by a tool that's very akin to the London Healthy Places approach, which looks to understand people's views on noise, shelter, shade, safety, and a number of factors that come into people's mind as to how they choose to travel and when they feel safe to do various things. So we've got public health engaged already within those discussions around the work that we're doing for that, and I think that will continue, and there's ever such a lot of behavioural science around these types of things across the industry as well that we're trying to ensure we're engaged in.
Great, thank you. Terry Douris.
Thank you. I support this speed management strategy draft. In particular, I was reading about place and movement and representing a largely rural area. One of the elements that comes to me very frequently is the what is regarded by those people who live in villages as the inappropriateness of some of the speed limits for entry and exit points into villages. And I'm hoping that perhaps with this new SMS, when it comes through, there may be an opportunity to just look at those again and view them in a slightly different light, especially as an awful lot of villages are being used as alternative routes to avoid densely populated highways. And that's putting further pressure on those roads. So I'm hopeful for this, and I know that we've talked about this in the past, and we'll probably talk about it again in the future, Rupert. But thank you.
Indeed, yep.
Okay, Phil.
No, I think I came back on the one I wanted to come back on.
Oh, okay, fine, sorry. Stephen, new developments.
Yeah, as I put in the chat, in light of the comments made, providing if we can amend or change the wording from autumn to October, it's just that I'm very keen to ensure that it has to go to full council, and I believe probably this document does, but I seek clarification on that. If it doesn't, then it's slightly less of an issue, because I don't think any of us disagree with consultation on this and getting this or any amended document like it in place. But as I said earlier, I'm keen to ensure that we're in place in time, that members, existing members, can have input into what they might want to use our HLB for next year on. Likewise, given the thrust of what is happening nationally and now with active travel, obviously more 20-mile-an-hour designated areas would encourage more cycling, more walking. So will officers equally be taking on board that issue in terms of taking forward future IWP projects? Because some of these might require pavements to be widened in the future, which itself lends itself to the road speed being reduced as a result of that. I give the example of Clarendon Road, where that's being done in central Watford. But on new developments, I appreciate this document is a refresh of the previous speed management one, but we have had problems with developers, and obviously developers have now rushed to put in a load of new applications in. I'm just concerned that we'll be behind the trend, and I'm a little bit concerned there's a mix between development management team and what we're saying on road safety and speed management, and that needs to be much closer together to ensure that developers up front, where they're being, building, whether it be 300 homes on a new estate or 3,000, the default will be this type of a proposal in the future. I'd like an assurance that officers will be taking that on board when they feed back to developers on their comments on their planning application. So there's 2 points there. Happy to change that to October or November, providing we can get it into the county council cycle and agreed before Christmas, which gives still members time to allocate monies and have influence. And second thing on the developers.
Shall I answer the second one first, Teresa, and then you can pick up the first one. So in terms of the discussions we have with developers, I'd just like to reassure you that we're already having those discussions, specifically in relation to the larger strategic sites, 200, 250 homes and more. There is a very, very clear steer to developers that they need to be making those as sustainable as possible in transport terms. And I know the team and myself have had many conversations both about developers and with developers to ensure that we're pushing them in that direction at every opportunity. And that continues. We do struggle a little bit more with the smaller 10, 15 house type developments where the measures within them are very small, but sometimes the SIL or Section 106 associated to them is also quite small. So the impact of the measures that can be implemented as a result of them aren't so significant as where we get the larger sites coming forward.
Okay, right. Okay, thank you. Thanks, Rupert. Phil, you're coming back on timescales.
Yeah, I'll now come back on 2 things. First of all, the development management side. Yes, very good points. I mean, we should be telling developers what we require. We should be telling the LPAs what we require. But obviously, we will be looking to work with the LPAs to make sure that gets into the planning conditions. Because once it goes from our desk as a recommendation, we can't control what happens at the planning decision stage. So we just need to work together on that one. On the timescale, Teresa just reminded me the next H&E panels, if we do have them in the old format, 16th of September and the 19th of November. So I think, would it be appropriate, Rupert, to aim for the 19th of November cabinet panel?
I think it would, Phil. Yes.
Thank you.
Okay. So what I'm hearing is that we've heard here today that we're going to try and make 19th of November cabinet panel. When then there'll be the following cabinet, and then we'll all be ready to go with whatever prior to Christmas. So, Stephen, given that undertaking and given that political process will mean whatever the process is at the time, and I don't think we can actually be specific at this moment in time as to what sort of political processes we'll have, whether it be special cabinet panels or panels, because we don't know, you know, how things are going to open up, whether there's going to be a second peak in COVID, etc., etc., etc. Are you happy that we leave? Would you be content that we just leave the recommendation it is, leaving it as autumn, because November is just about in autumn still, and political processes covers the whole broad spectrum? Are you content to leave it as it is? I can't see any need to actually put in specific panels.
No, I understand what you're saying. I appreciate the need for the wording of the specialist, but I was just slightly, actually November is technically autumn. It's technically winter rather than autumn, but anyway. But I'm just concerned it goes to the highways panel, then goes to cabinet, which is the 14th of December, and has to go to council. If it has to go to full council, that means it misses the 15th of December full council, and we won't get it to full council until February if we have to formally adopt it as a full council meeting.
Do we have to?
I just want an assurance that we're not, the democratic process which we rightly go through doesn't stymie. If we've all agreed it at highways panel, which means automatically it's going to be agreed at cabinet, we aren't stymied because we only have one day between cabinet and county council.
Okay.
It has to go to county council. That's all I'm seeking to assure, that we have it agreed in December so that members have that opportunity.
Okay, so does it have to go to full council, Rupert? Do you know?
I don't know for sure, but I don't believe it would, given where I think it's been previously. I think it was a cabinet decision and adoption.
Okay,
but we can clarify that as soon as we can.
I think I need to get that one sorted. Is there an officer online that can actually say whether this strategy?
Deal with that offline, if I may make a suggestion. If Rupert's right, it doesn't have to go to council, then I'm fine. If it does have to, maybe we could just agree amongst us if we need to have a earlier meeting to get it to the cabinet and then full council, we could do it through the processes of the group leaders agreeing something. If we're all of the same mind on this one, because I don't think anyone's disagreeing, we need to have these changes in place.
Okay. Phil, please, are you okay with that?
Yeah, I'm fine. Yeah.
Yeah. Okay. So we're leaving the recommendations as they stand, and we are all cognizant that we want to get this done and dusted before the end of 2020. All the political process. Are we okay on that? Okay, lovely. Thank you very much. So the recommendations are set out in your agenda. There's no amendments. Can I ask you all to vote for, against, abstain? Okay, that's all agreed. Thank you very much, colleagues. Moving swiftly on to item 6, which is LED street lighting illumination strategy. I have down here, no, I've got Anthony. So Anthony, you're going to present this. Thank you very much.
Thank you, Chair. Peter Simpson's also on the call, who's the Senior Asset Manager in the Highway Service, and will be a better place to ask any detailed questions that members may have. I'll give a very brief introduction because I'm aware that this is a topic which has elicited quite a lot of conversation between members in the past. The LED project to change our lighting was substantially completed by the end of March. That means that most of our streetlights are now operating as LEDs, and we can operate them from a central management system. So we can change the timing of the lighting and how much they're dimmed from a central system. This report outlines a proposal to deal with requests to change the part night lighting arrangements from 1 AM to 2 AM, and in consequence for those lights to then be dimmed between 5 AM and 6 AM. The proposal is that members will identify one of 3 types of destinations: either a transport hub, a hospital or emergency service, or a place of key employment, and that those destinations operate until at least 2 AM in the morning. And then for the member to propose routes that would connect one of those destinations to an A, B or C road that's in full night lighting operation. That's a very brief summary, Teresa.
Okay, thank you very much. Phil, do you want to say something?
Thank you. Yeah, just to remind members that Cabinet did agree that the principle of allowing some lighting up to 2 o'clock was agreed, but myself and the officers should go away and come up with criteria as to when that can be agreed. That wasn't an easy process, but I'm pleased to see that we come up with a transparent, understandable and realistic criteria, and it would help the people that are having to come out of stations late at night, having come out of the local nightclub late at night, etc., hospitals as well. Yeah, I think it's understandable and a realistic approach to switch lights onto 2 o'clock in certain areas.
Okay, thanks very much. Thank you. Asif, I know you have to leave at 1:30, so would you like to put your question first or comment?
Yeah, yes, please. Thank you so much. So my point is actually the criteria, and I do welcome the change that's being proposed. But my thing is about the criteria being so rigid that actually it doesn't allow things to happen. So, for example, I'm going to take Watford as an example. We've got a big nighttime economy pro-COVID, obviously. And so it needs to be a bit explicit about, Steve did mention, it was mentioned about nightclubs and so on. So nighttime economy, people coming back late to their homes, and just thinking that there are issues about the rigidity of the criteria, where actually very few roads will meet that, and as a consequence, it doesn't benefit where it should benefit.
Okay, yep. Who's going to answer that, Anthony or Peter?
I can start, and Peter may wish to add something. How rigid the criteria applied is really up for, I think, for discussion. Because if, for example, there's a destination and there's numerous routes from that destination to A, B and C roads that are in full night lighting, then there can be a discussion about how many of those routes should be changed with the part night lighting arrangements. But what we'd be looking for is something that's a sensible approach rather than a circuitous route to get to an A, B or C road. Does that help?
It does, but can I just forgive me? But if a uniform change occurs, does that have major cost implications in a particular town? I'm just looking at the logistics of this road and this road is increased to 2 o'clock, and the other road isn't increased to 2 o'clock. If a uniform approach can be done, which is actually sensible, I think that the suggestion being given. Why isn't that approach being taken?
I think I'll defer to Phil to answer that one, Teresa.
Okay, Phil.
I think it's fair to say that to take Asif's suggestion, you could be lighting up all the roads in Hertfordshire until 2 o'clock. Most people have got nighttime economies, and I think this criteria has actually buttoned it down to where it's really needed. And we don't think the public, as a rule, wants us to turn lights on after 1 o'clock as a general strategy. So therefore, that's not what we're offering.
Do you wish to come back, Asif?
Well, perhaps in Watford's a different, from my perspective, it is something, but that's a difference. So perhaps a division or a town could have a different approach to every single street, and some areas might not want it, but I can tell you from my perspective it is.
Okay, so officers and Phil are hearing you on that. Okay, I'll move on if I may. Sorry, I've lost myself on this list. Steve Jarvis. Are you there,
I
Steve?
didn't think I'd said I wanted to speak on this yet, but I was going
to. Oh, no, sorry. I'm sorry. This is the trouble. I've got so many names in front of me. Don't worry. No, it's all right. It's Stephen. Sorry, you can come back later.
I thought it might be me. Having too many Steves or Stevens.
Oh, it's the list doesn't move.
Yeah, I mean, I think Phil and I think the administration is well aware of our group's view, which I think it's to some extent replicated by the Labour group's view, because we proposed budget amendments as way back as February 18 to allow the local flexibility for the lights to stay on till 1 o'clock, or indeed now till 2 o'clock. And I think there's two issues here. One is the CO2 emissions, i.e. the second part of our amendment we put down. Because at the same time, we have always proposed, and we've always felt it ludicrous, I have to say, that lights are on in full lighting from 5 in the morning to 6 in the morning, whereas the lights after 10 o'clock at night are already dimmed, and then they're dimmed further at 11 o'clock. So in fact, the lights between to 1 o'clock, and indeed on this proposal to 2 in the morning, are already running only at 20% of their LED emissions. Now, had we adopt a policy of actually just dimming the ones between 5 and 6 to the 50%, as is now proposed, and I'm pleased that's at last being taken up, but it's only being taken up in the same roads where you're keeping them on till 2 o'clock. So we'll have basically a fourfold system. So in one road, the lights all go off at 1 and then are in full lighting at 5 in the morning. The neighbouring road, they stay on at a dimmed level till 2, and then they're dimmed at 5 in the morning at 50%. So to me, that doesn't seem logical, and I would have to say, I'd echo what Asif said. It's going to be a mixture. At the very least, I believe we should be dimming all the lights between 5 and 6 to the 50%. If it's okay for one road, it's clearly okay for all roads. I think there's a different debate about how long they stay on. And had you done that, as we suggested in February 18, you would have saved 436 tonnes of CO2 carbon emissions, and actually made a financial saving of nearly £100,000, according to the officer reports that go back, in fact, to November 2018. Those were the figures in those reports at that time. Hence, I'm speaking at the same time, Teresa, to help things move along to the amendments, which I formally move, those two amendments, knowing full well I think the first one will be lost. But I'm hoping, I really am hoping, you'll take on board the sensibility of actually dimming the ones, all the pipe night lighting ones, to the 50%. We go back to localism and having local decisions, and I echo what Asif said here. In Watford, the residents in residential side streets want them to stay on to 2 in the morning. So it's all very well to say, actually, if you live, if you arrive at a train at Watford Junction, you come out of the train, St Albans Road is lit up, but actually you live up in Judge Street off of Leavesden Road, so you have to walk along St Albans Road. You then are going to Leavesden Road, the lights are off come 1 o'clock, and your light in Judge Street is off come 1 o'clock. And this is, I'm picking an Asif's division because he knows it very well. Then actually that doesn't help that resident because they're having to walk in darkness. So wherever you find an area with the nighttime economy, or for that matter, more importantly, in my view, people coming back from London, then they're having to walk in dark. So it should be left to local members, in our view, to make that decision. And I totally agree with Phil that one size does not fit all, and in certain communities, they don't want them on. And indeed, that's not the case. They want every light on in every street. I've got cul-de-sacs, and all I've asked for is the one street light in the turning head to be left on so that people can understand where the end of the turning head is when they're walking around at night or coming back at night. So hence, those are the reasons for the amendment. But fundamentally, if we're adhering to the green agenda and climate change agenda, and we know we can do the dimming between 5 and 6 a.m, we should be doing it. Irrespective of whatever other decision you make today, we should be making that effort to reduce the carbon emissions and making that saving, which is also a financial saving to the authority.
Thank you. So I suspect that might be Peter to respond to the technicals here. All lights dimmed from 5 to 6, and the savings of CO2 and pounds, and why not, Peter?
Yes, sorry, I just put comment, please. Yeah, no, that's entirely correct in terms of that's all doable in terms of making that adjustment, and that will be for Cabinet to, or this panel to decide. So that's all technically feasible, and that is in line with what we reported previously in terms of any time that we dim, then there's associated carbon savings and financial savings.
Okay, so Phil, can you just clarify on this one? I have to say, I thought all roads were going to be dimmed from 5 to 6,
No.
but that's not the case.
I think we all agree that is a possibility, and it's something that we may be reviewing in the near future, given in mind future budgets, etc. But I would suggest it's not part of this paper, and it's for decision later on. It's something that we could do, but at the moment we don't think it's appropriate to bring this in just overnight, basically. I would just like to make another point on lighting streets up nearer to people's houses. If you start doing that, it will be inconsistent. There will be people living in streets that will look over their shoulders and say, well, that person in Watford's got their cul-de-sac lit, why can't we have our cul-de-sac lit? So we're trying to be consistent here and save the situation where everyone's going to be asking for their lights to be on until 2 o'clock. So we don't think generally that's a requirement for the county.
Okay, well, let's see, get the right order. Bear with me. Nope, no. So, Eric.
Thank you, Chairman. Phil's actually just said what I was going to say, because we can say that we speak for residents in a particular area, but not all residents are the same. So I think it's important to give people the opportunity, and particularly the proposals as they are actually make a lot of sense, because they're clear and it gives guidance, and it's particularly talking about transport hubs, hospital emergency services, amenities, key places of employment. And as Tony said earlier, there's a little bit of flexibility around that, because there may be roads around the fringes. So what we want to avoid, as Phil was just saying, is that there will be a misunderstanding on the part of residents as to why the roads are lit up till 2 in some areas and not in others. And I think we could make decisions on behalf of residents, because we have a very vocal group of people asking for it, but there'll be individual households that are absolutely against. So my view is this actually helps the process and helps us to understand it. And certainly I think the second part is for later on for discussion with the budget. Thank you.
Okay, thank you. All right. So did you want to speak again, Stephen?
Yeah, just briefly, because I posed this question to officers in terms of examples of roads, and I gave 2 examples where the issue in Watford, and actually they said one set of residential roads, which is parallel to another, could meet this criteria if this was adopted by the council, because it was a straight line road between Rickmansworth Road and Vicarage Road, and hence the hospital. But the neighbouring road wouldn't meet the criteria. So we've already started to create, and then maybe parallel road that is as well, because wouldn't meet the criteria, because they deemed that one road was therefore a more direct route to Vicarage Road and the hospital, whereas the parallel road next to it isn't. So we're already going to create a twofold system. Now, I accept we're not going to win on this one, but I do really urge members, you could make your contribution now to carbon emissions by adopting the second amendment, which is basically we've dimmed to 50%. You've been told by the officers you can make the saving. You've been told by the officers you can do it. And actually we're sending a very big message out on climate change to the wider community by doing it now. And we should have done it 18 months, 2 years ago.
So I'll go into debate, I think, around the amendments which you've got. So I'm a little bit confused. So I've got a proposed amendment 1. So if you put in 2 amendments, Stephen, on the assumption that amendment 1 will fall, And
I am indeed. I'm realistic, as you know, Teresa. I know full well from what's been said already. I have formally moved them, and I think Steve Jarvis is going to formally second, or will speak to them. I assume Amendment 1 will fail, but I'll move that, and we want to just vote on it. I think we've probably had the discussion. The Amendment 2 is solely relating to the 50% dimming between 5 and 6, and thus reduce the cost of the CO2 emissions. So it doesn't change the new policy that's being proposed, which we don't think goes far enough, but we accept that's what you're going to vote through.
Okay, so there's two amendments. There's Amendment 1 and there's Amendment 1A. You're moving both. Stephen Jarvis, are you seconding?
Yes, I'll second those.
Thank you very much. So we'll move into debate. Can we debate them both together? Hopefully, I think I can manage that one. Phil, would you like to speak first?
Yes, please. I've really said what I wanted to say about the amendments, because really they are feasible, but that's not part of this paper. That's not part of what we're trying to get through today. It is something we will continually review. Part of our manifesto was to use the new control systems to actually review LED lighting, and that's exactly what we will do going forward. But today, that's not the proposal in front of us.
Okay. Any other members wishing to? Did you want to comment again, Peter, or not? No. Okay. So any other members wanting to make any comments? Right, so Steve Jarvis, you wish to speak?
Sorry about that. Took a while to get myself unmuted.
Yeah.
I mean, I note what Phil has said, and from what I understand he's saying is that although this was suggested over a year ago and it would save the council money with no downside at all, that he's not prepared to consider dimming the lights at 5 o'clock in the morning, between 5 and 6 o'clock in the morning, simply because he doesn't want to do it. And it seems to me that's a very poor justification for spending £80,000 of the council taxpayers' money at a time when we're told that the council is under increasing financial pressure. It just seems to me to be irresponsible to say that he won't do something, presumably because he hasn't thought about it enough when it was raised a year ago. Is that really his position?
Okay. Thank you.
Can I just add that one?
Are you going to come back now, are you? Okay.
Yeah, I will come back. That's a bit disingenuous. That's not what I said. That's really misrepresenting it. And I just do not feel I need to speak any more on that.
Okay. Richard Roberts.
Thank you, Chairman. Trying to pick apart the minutiae or the pinhead with which Steve and Stephen are dancing at the moment is proving to be, for the listening public and for those in this meeting, somewhat tedious. I would like to support the flexibility being given to members so that they can choose to which highways linking to the 3 key areas as outlined, and therefore to link to lit pathways as they see fit. In my post bag, and I think for most, there is very little demand for messing around with lighting. It has gone down extremely well as it's been rolled out across the county, and thank you to officers for doing that, and thank you to Phil and his predecessors for doing that. I would like to move these recommendations, whilst absolutely accepting what Phil was saying, that if we want to review these in the future in terms of the amount of lighting in total, then we should do that at that time. So full endorsement from me. Thank you.
Thank you. Ralph Sangster.
Thank you, Chair. No, I just wanted to comment on the fact that making policy on the hoof like this is never a good idea. I remember my time as Highways exec member when dimming was first considered as an option, there were concerns regarding the environment in which the dimming would take place. And I'm sure the officers are right in saying that the lighting could be dimmed between 5 and 6 and save the money and save the CO2. But I'm sure they would like to reflect on the issues that would be associated with the environment in which that occurred. And that's not the same in every situation. So I think Phil's proposal to consider that and to bring it forward perhaps later is a good proposal.
Thank you. Terry Duras.
Thank you very much indeed. I confess to being confused because there seemed to be a lot of talk about and Stephen is proposing dimming the lighting by 50% between 5 and 6 a.m. But if you look at the recommendations on the paper, it says, unless I have misread it terribly, and to dim the lighting by 50% between 5 a.m. and 6 a.m. within the park night lighting regime. Admittedly, it says where there is local justification for doing so. So I really don't know what the argument is about it. It seems to me to be a very straightforward recommendation that we should adopt. There'll always be people who will disagree with the pinheads, but we have a recommendation, we should endorse it.
I think it's actually that it's only in those areas where this change is being made between 1 and 2.
That's right. Yeah.
Can an officer please just confirm that? The recommendation relates to dimming 50% between 5 and 6, only in those areas that are extending the lighting from 1 to 2.
Yes, that's correct.
Peter?
Yeah, yes, that's correct.
Okay, thank you.
Yeah.
Thank you. Okay.
Thank you.
Is that okay, Terry? So it's only in relation to those areas that are being extended to 2 a.m. They are seeking to dim from 5 to 6, basically to compensate in cost.
Okay, thank you.
Okay.
Yep.
Right. Stephen, you want to come back?
Well,
do you?
In terms of summing up on this is not making policy on the hoof. That's the paper that went to the Highways panel in November 2018, where this was a possibility and where we moved the proposal based on the officer's report written in November 2018. We subsequently proposed that in February 19 and we proposed it again in February 20. It is disingenuous of Ralph Sampson to say this is policy on the hoof. This has always been our position in terms of the 50% between 5 a.m. and 6 a.m. And clearly, as you've now explained to Terry Juris, the policy as it currently stands in the paper before you is a mess. So only certain roads, i.e. those that meet the criteria to keep them on to 2 o'clock, will have the lights dimmed. Now, that will make no logic whatsoever to residents, quite frankly. Whether you can perhaps explain, you going to the hospital or you're coming back from the station and therefore that's the route, but actually saying, well, why aren't all the lights the same at 5 in the morning? Indeed, why do we need them at 100% illumination at 5 in the morning? The point is, as was made in November 18 in its very report to the Highways panel, is that we don't. So it is not policy on the hoof, and I'm staggered the administration want to waste CO2 emissions and money in this way.
Thank you, Stephen. Okay. So how are we going to do this one? Can I just ask, Phil, can we give an undertaking to look at the 50% emissions between 5 and 6 for all park night lighting to come to the next panel at all? Are we able to do that piece of work? Have I lost everybody?
I'll ask Peter if that's feasible.
Yeah, that's fine. Peter, is that feasible to bring back a paper on the 5 to 6 a.m. 50% reduction and all park night lighting for consideration for the next panel, which will be in July? I think, are we in June? July, yeah.
July, that might be a bit too soon, I think, in order to run the calculations. I'd have to look at the time scale leading up to that, maybe in the autumn. What are your thoughts, Tony?
No, I think July would be too quick to get through the calculations and then the political processes to clear papers.
Okay, but we can do that. We can bring it back to a future panel, because I accept that we have a recommendation here today about that particular phasing, but I would be keen to see something on the 50% from 5 to 6, even if it's not taken forward. It's something that I'd like to get into the process, particularly as part of our sustainability strategy work. Okay, so I'm making that ask. So I've got Ralph saying, can he come back? And Judy, you would like to speak. So I didn't see your name come up before, Judy. So Ralph.
As my just trying to get my
you're there.
Okay, really nearly there. Yeah, I think my point is that in making my original remarks was that when you're trying to amend a piece of a paper like this, which has had a lot of consideration given to it and a lot of calculation put into its proposals, to try and amend it without giving the officers an opportunity to review the amendment and consider the implications of it is in so much as I'm making the point, making policy on the hoof. We need to give officers an opportunity to come back and give us the opportunity, give us the full implications of what we're proposing, and any pluses and any minuses, and then we can make a decision that's appropriate at the time. That's all I was trying to seek to make the point.
Okay, thanks. So quite agree, we can't do policy on the hoof. Also, panels can only make recommendation. Panels do not make policy. Cabinet makes policy. So I am asking officers to bring back a paper as soon as possible, probably not July, but perhaps September, on this aspect of 50% reduction from 5 to 6. And then we can all look at that again in the round. So Judy was just telling me that she was here because I couldn't hear anybody. So thank you, Judy. Right, so is there any more debate around the amendments that have been put and seconded? I don't think there is. I think we've done that one. Okay, so I'm going to put for the proposed amendment number 1, and you've all got a copies of those. So all those in favour, please show. Has everybody voted? Has everybody voted in relation to Amendment 1? So I think that falls. Okay, yes, that falls. And then can I ask you to vote on Amendment 1A, please? I think that one falls as well, but wait for officers to confirm. Yep, that one falls. Thank you. So we go back to the substantive recommendation as set out, please. All those in favour, please, well, all show, please. Okay, that one's got through as well. Thank you very much indeed. So nearly at the end.
Oh, just on the last one, my group want to be recorded as voted in favour of both of those amendments, please.
Right, okay. Yes, we can record those. We can record how people have voted. Yes, that's fine. Thank you. Just to remind members that we have asked for a report to come forward later in the year. Okay, so we're now moving on to item 7, additional school places. I don't propose to, could members let me know if they have any questions that need to go into part 2 in relation to this item, as I'd quite keen to move this one through. Has anybody got any matters for part 2 on this item? If I don't see anything shortly, I will assume there isn't, so we'll deal with it all straight away in part 1. So officers, do I need to actually take a vote on the part 2 on this? Can somebody indicate?
Chair, in the absence of advice from the committee officer, yes, I would expect that you should still take a vote on the.
Oh, wait, okay, I've got it now. We still need to move to part 2. Okay, yep. Fine. I've got several members saying they've got to go to another meeting at 2 o'clock. Thank you for your forbearance, everybody. Very long agenda today. So can I ask Pauline Davis, please, to make the presentation?
Thank you, Chair. This report seeks capital approval for additional school places and is in 3 parts. The first part identifies the need for a new 2FE first school for Buntingford from September 22. It seeks specific approval to Section 106 agreements for that project, and we're just asking panel to note that we will need to run a competition in the autumn for a sponsor to run the school, and that we hope to use, well, we intend to use this project as a pilot to evaluate what working towards net carbon zero would be for this school. The second part of the report is about secondary places and identifies a need for an additional 1 form of entry in Hemel Hempstead for 2022. That is proposed for Adeyfield School, and we are also asking you if we can have approval to enter into a funding agreement with the Academy Trust for them to deliver the project. The third part just seeks approval to specific Section 106 funds for a number of previous school expansion projects that are listed in the Appendix A, totalling around £4 million. And generally financially, the overall position is reported in Section 5, and more detail is in the Part 2 report. And I think I'm quite happy to take any questions you might have.
Okay, thanks, Pauline. I should have said Pauline's head of school planning, so thank you very much, Pauline. Are there any questions for Pauline? Oh, sorry, Terry Duras, do you want to say anything first?
Very briefly, to support this, with regard to the Adeyfield development, Adeyfield School currently runs as a 5 FE school. All the others are at least 6 FE. So this, quite apart from meeting the demands of the area, will actually start to bring it up to parity with the other schools, which has to be a good thing. with regard to the Buntingford project, it is one of the first whole new school on a whole new site, and that gives us the opportunity to engage with this and produce a pilot school, hopefully meeting net zero carbon, and to see how that develops, and it will help to inform us with the outcomes going forward. Bearing in mind, of course, that we have a huge building programme that we're going to engage in the forthcoming decades to meet the requirements of our young people. But I would nothing further to add other than to hope that everybody will recognise the value that this paper brings and to support it.
Thank you. Yes, can I say I'm delighted about having a net zero carbon school pilot in the county. I think this is yet again Hertfordshire sort of in effect trend setting, as we did in the 50s and 60s with new schools. Okay, I have Mark Watkin who's indicated to speak.
Oh, sorry, Terry. I think it's 4 hours of this meeting is beginning
Yeah,
to
I know, it's tough.
my brain.
Don't
I just
worry.
wanted to say, look, we really support this. I mean, particularly the carbon neutral. I think that yes, the county has to be seen to be leading in terms of buildings that are sustainable and have minimum impact on the environment. And I take note that yes, in a way, this is a sort of calm before the storm. We've seen the primary school expansion go through huge numbers of new additions and extensions, and I absolutely understand that we'll see secondary school needs following shortly thereafter. So it's nothing but to say, yeah, we support it, and be very interested to see what the building's like. I'll be fascinated to see what actually comes out of the design system. I'd love to see the school when it's completed. Thank you.
Okay,
If
lovely.
I may,
Thank you very
Terry,
much.
if I may, Terry, just pick up, sorry to interrupt you, but we have a proud history of this because back, as you mentioned, in the 1950s, we developed the SEAC School of Building, which produced a large number of new schools. And this is Hertfordshire, hopefully being alert to the requirements of the future. So it's good thing for Hertfordshire.
Absolutely, absolutely. Are there any other comments from any other members? Excellent. I'm afraid we have to go into part 2, I'm told by officers. So we're just going to have to shut down the recording for a moment, go into part 2, and I will read that under section Okay, so we're now back in part 1. Thank you very much, colleagues. So I'll now put the recommendations as set out in the agenda. Please could you all indicate if you are for, against or abstain? Okay, that's all been agreed. Thank you very much indeed. Exciting times. Okay, moving on to agenda item 8. There have been no public petitions. I'm hoping that there is not any other business. And just takes me to say thank you very much, colleagues, for your forbearances today. It's been a very good meeting, good discussion, and I'll see you next time. So thank you very much indeed. Thank you.
Well chaired, Teresa. Thank you very much.
Well done. Well done,
Teresa.
Teresa.
We may disagree on some things. You chaired it very well.
Thank you.